Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Chaplain Frank Lidke from Tarrant County. Thank you for doing that today, sir. After the invocation, please remain standing for our pledges.
Shall we pray? Father, we thank you for this time that we have. Lord, the Bible says, in your scripture, you said in James chapter 1 that if any man lacks wisdom, let him ask of God, who giveth to all men. And so, Father, I pray that you give our leaders the wisdom they need. Lord, they make decisions that influence a lot of people, and I pray that they wouldn't make good decisions, but they'd make best decisions. So lead them and guide them. Father, we also pray for our law enforcement and first responders, Lord, and the leadership there. We pray that you'd keep them safe, as well as those that are standing guard, Lord, in the jails, that you would protect them as well. Lord, give our president wisdom, Lord, in our country, and help us with this time that we go through, that you would be with us and we would feel your presence. So thank you for this time. We ask your blessing on this, we pray. In Jesus' name, amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you very much.
Mr. Manius, agenda announcements.
Thank you, Your Honor. Members of court, we have several announcements as it relates to the agenda. First, the specific ones under Facilities Management, item 8E3. This is approval of a change order for Frontier Weatherproofing. We're going to hold that particular one for 1 week. Also under Purchasing, item 8I1. This is RFP 2020-035. Criminal Courts Administration has asked that we hold that for a period until we can make sure that the time limits or the time of that is appropriate because of the COVID impact on the county. Also, members of court, as we did last week, we're going to move a briefing item up, and Dr. Tanage will be doing that at the very front so we can begin the discussion on COVID ID. And then finally, members of court, under briefing also, the Tarrant County Hospital District monthly update. That is going to be postponed at this time. I spoke with Mr. Early this morning, and we will schedule that in the near future.
Thank you. Thank you. Court members, you have before you the minutes of our regular meeting of April the 7th.
Move for approval.
Second. We have a motion and a second. We're going to vote. Now, can we take the three off there and then we just have to ask for...
Sure. Yes.
This will make this a little bit quicker. Commissioner Brooks?
Yes.
Commissioner Johnson?
Yes.
And then the Commissioner Fickus, who's voting for Commissioner Johnson?
No. I'm not. I'm going to take his. You want that off?
Take that off.
Okay.
And then put yours on. So it's, the three of us also voted to approve the minutes. So minutes are approved unanimously. You have before you the consent agenda.
Move for approval.
Second.
We have a motion and a second to approve the consent agenda. Please vote. Commissioner Brooks?
Yes.
We're going to go through this. Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. The consent agenda is approved unanimously. Mr. Manius.
Thank you, Your Honor. We can now go to the briefing item. I'm going to ask Dr. Tanasia to come up and begin the briefing. I believe that you'll find a copy of his PowerPoint in your red folder this morning also.
Good morning, Your Honor, and members of the court.
Morning.
We're going to go over the current status of COVID-19 in Tarrant County again this morning. And as always, we start with our situational awareness with global case counts. If I can get a click for the dashboard to be brought up. So we're at about 1.9 million worldwide cases. As you can see from the chart, there have been about close to 121,000 deaths reported. And in the United States, we're at about 582,000 cases and some change. What's interesting now, a new addition to this dashboard, is the total number of tests that have been run in the United States. We're at about 2.9 million, with most being in New York State at about close to 500,000. Texas is now number 4 in the country from a testing standpoint. We have about 133,000 tests that have been run in Texas. If we can go to back to the slide, and I believe the DSHS dashboard. There we go. This is the Texas status, if you will. Close to 14,000 cases and 287 deaths reported. And again, Tarrant County has now 806 reported here, which is running about 2 days behind. I think as of this morning, we had 929. Thank you. I was trying to look that up. 929 cases altogether. So we're number 3, unfortunately, in the state of Texas from number of reported cases. Let's get back to my slides. All right. So just looking at it from a map standpoint for the United States, the darker colors are, states reporting more than, several hundred cases, almost thousands of cases. And Texas is getting there. Obviously, we have more than 5,000 in this color scheme. And the colors get deeper when you have more cases, for the map. So, Tarrant County situation. There's been a lot of questions asked, are we bending the curve? All the things that we're doing, is it having an impact? And yes, it is. And we added that to our Tarrant County dashboard. If we could have that come up. And if we can go to the third tab of that epidemic curve and then go to full page. There we go. Okay. So the graph that I wanted to really bring your attention to is the graph on the right. It's the doubling rate of COVID-19 in Tarrant County. So there's a lot of caveats to the data. We're relying on specimen collection date because that's the easiest one available. But what I wanted to show you is the blue line. That's the current curve of the epidemic in Tarrant County. And the red dots are really the executive order dates. And if you look at the beginning of the chart, there is not a red dot because the chart actually starts on March 14th. And our emergency declaration and the first executive order came very early on March 13th. The chart starts typically at 10 cases, and we had only 8. So that's a reminder that we started really, really early in Tarrant County to take the right steps to bend the curve of this epidemic. And as you can see, as we placed more red dots, the curve kept getting bent. So I wanted to make sure that people understand that these actions that our county has taken have really impacted the way this outbreak has emerged in Tarrant County. We have not seen a spike like we have seen in other places. If no action was taken, it is very likely that the first line that you're seeing, the dotted line, that cases were doubling every day, would have been the trajectory that we would have followed for quite a while before things started to slow down on their own. So this is just clear evidence that yes, we are doing the right things to bend the curve in Tarrant County, and that's why we're here. Our doubling rate right now is about 4 days approximately, which is still pretty fast for an outbreak. But I just wanted to highlight that it's working and we need to stay the course. So if we go back to my slides. All right. The question's been asked, when is a projected peak? So this website, it's covidactnow.org. It's an entity that's been putting projections for Texas. But I pulled out Tarrant County. Now they have county level data. And there's a few things that I want to highlight. We're at the bottom, the light blue teal color at the bottom. That's where our curve is right now. And that's because we've taken a lot of preventive steps. When I started looking at this website, they had Texas data and then they added Tarrant County data. and Tarrant County was in a deep orange, just like the neighboring counties to us. If you look on the Texas map, Denton, Collin, Dallas, Kaufman, all these counties are still orange. We're in the green as of yesterday. Till Sunday, we were in the orange. And that was based on some projections they had because, it takes a while for them to catch up on what's happening with our data in the county. But what that meant was that, the projections were that there's not been enough done in Tarrant County to slow down the curve. And initially when I started looking at this, they were projecting a peak like at the end of March. Then the peak moved to middle of April, late April, early May. And as you can see now, if things get relaxed, the peak is still going to occur, and it may occur in June, but it's been pushed out. And the height of the peak is also lower than what we originally were seeing on this chart. But if we stay the course with the strict stay-at-home policies that we have, we will probably follow that light blue teal trajectory, and the peak will really be a very small peak, and the trajectory will be long and slow. And that's what is ideal. So the message from this website is keep staying at home, Tarrant County. I think that's the main message that we can all take away today, is that we're doing the right things in Tarrant County, and we need to keep the course. And again, can we go back to normal? Things are looking good. I mean, can we reopen everything and start going back to what we were doing? Too early to say that. Quite honestly, pandemics are not a blip on the radar. It's very easy to fall into that. Okay, things are looking better. Let's ease up restrictions because we all want to get back to normal. But it may change the course of the epidemic in our community. So it has to be very thoughtful, methodical, just like the discussions we've had, with you all. And I know the governor's been saying the same things, that it's going to be a very slow, thoughtful, methodical process to reopen our economy and reopen our communities to get back to normal. And, the message today still applies, stay at home, Tarrant County. And there's going to be a lot of discussion on when's the right time to ease up on the restrictions, and we will get there. But part of the thing that will really get us back to normal is a little bit farther out, and that's the availability of vaccine, right? Once you have that, if you remember the H1N1 days, we had mass clinics with a lot of people getting vaccinated. That really, really is the way to get back to normal, but there are other things that we can do to ease up on the restrictions when the time is right. So what comes next? Well, unfortunately, more cases are going to occur. I mean, that's just reality. We have a little bit of a momentum behind this outbreak, and that's going to carry it for a while. And we may see more deaths. This morning, we're going to be announcing 4 more deaths in Tarrant County. The total will be 29. But it's unfortunate. With any large outbreak, you see those. 1 death is too many, but it's the reality. So what is the main message? Social distancing works only if everyone does it, and we all need to be doing it and continue to do it for the near future till we change course and we really have good confidence that we've really broken this outbreak. Till then, we stay the course. And I want to remind everybody that the mask use guidance is out for the general public. So if you're out and about in the community where you can't social distance from each other, definitely carry a mask with you. Wear it, and it doesn't have to be a surgical mask. It can be any cloth-based mask, scarf, any cloth-based face covering. And again, as always, takeaway messages are listen to our leaders and take action today. If you haven't done some of this stuff, you need to be doing it now. We're in this together, and we must work together as a community, staying separate, staying home. And our community is resilient, and we will get through this. So then I'll pause for any questions.
Benny, could you?
Go
ahead, Commissioner Brooks.
Just a comment. Thank you, Benny, for your report. And although I could not see your various slides, I am convinced that what you said is that we're doing the proper things and that now is not the time to stop doing the proper thing. The proper thing is still stay at home. Though we have managed to perhaps flatten the curve somehow, somewhat, there's still a surge out there coming for us. We have not peaked in Tarrant County. and now is not the time to relax any restrictions, to stop anything that we're doing that has gotten us to these positive numbers. The message to our public is to stay the course, stay home, stay healthy for the ones you love.
Thank you, Commissioner.
Commissioner Allen, did you have a comment?
I did. Vinny, if you could go back to the dashboard, I know that there have been some changes since our meeting last Tuesday, and if you could talk about what those changes are.
Sure. If we can look at, okay, so let's get back to, first of all, the summary statistics page and then go to full screen, please. Just on our dashboard. So Commissioner, yes, there's been a lot of asks coming to us from a variety of different places, so a lot has changed. So this is sort of a redesigned dashboard, and our goal is to now hold it here for a while and not add more things because it gets very confusing for people to follow what's what.
Forever.
Yes, sir. Forever. Yes, sir. So there was ask about creating a summary page as if, like we're used to reading reports, there's an executive summary, the main highlights, and then, of course, the details come later. And this summary statistics page does that. It's a summary of all highlights of information on the further pages. And we have the main things here that where are we from a community spread level? It's still substantial. All the deaths and cases reported. We have some graphs that show how many cases have occurred by age group and how many deaths have occurred by age group. And similarly, cases and deaths by gender. Even though they're on the same chart, I would urge people not to draw like quick comparisons. That's not the intent of that chart. I mean, it's natural that we draw comparisons, but I try to avoid that because there's more that goes into it than just looking at one number versus the other. And then we've also added hospital capacity key metrics. These are, reported to us through various sources. And that is now at the bottom of this summary page because there was a lot of interest and questions about that information. Then our case counts page, if you go to the next page, the second tab, has pretty much a breakdown of how the reports are coming to us on a daily basis, and that has a little line chart, if you will, and it's based on report date, how we get the information, and then once some analysis is done, that's not how the outbreaks typically are progressing. The best metric is really the onset date, but that takes a while to do all the interviews and get all that information. Sometimes it's not available because people have forgotten when they've got sick. They have vaguely an idea. So the best date we use as a proxy is a specimen collection date, and that's the epidemic curve that we've built on the third page that I showed you. And that goes over specimen collection date chart. But every set of data has some artificialities in it or some challenges. If you can see, there's waves and dips on these charts. It's because Saturdays and Sundays, most people don't go to doctor's offices and things like that. They might go to an urgent care, so the reports and the specimens collected on those weekend dates are lower. But that doesn't mean that people weren't getting sick. It's just how they went to healthcare. Cases by location. That is our mapping area, if you will. That has a breakdown by zip code and by city boundary limits. And there's a table. People wanted to see the table by their city. So we added that on as well. And then case characteristics has more details as well, if that's the next tab. And we've seen this before, which is broken down by percentages, age group, gender, race, ethnicity, types of transmission, source of lab testing, and hospitalization status. And I know there was a request made last week at Commissioner's Court because people wanted to see race and ethnicity data, so we have that posted here. And then, let's see, on mortality statistics, it goes down into the details of deaths have been reported. Same kind of breakdown by age group, gender, race and ethnicity, and all the other details that we have on those. And then the other two tabs are lab data. This is mostly information reported from our own public health lab. The left chart is total number of tests that are run on a daily basis, broken down by negatives and positives. And the right chart is total number of test runs in the lab period. because we do serve other counties, and that shows you sort of the volume distribution between Tarrant County and other counties. And it's based on how the requests come in. It's not necessarily we're picking one over the other. It's just whatever came in that day. And the last tab is a syndromic surveillance tab. It's a COVID-like illness. The definition is up top. That's why there's so many words on that chart. But it's very similar to what we use for influenza-like illness. The purpose is not to look at each individual visit. It's the overall trend in the community. And so far, the overall trend is up. You know, people are seeking more health care with a COVID-like illness. So that's kind of the overview of what we've done with our dashboard, and we plan to stay there. Yes, sir.
Thank you. Will you go back to, I think it's case characteristics, the one that shows breakdown by gender, ethnicity? Okay, great. So at this point, with your expertise, are there any conclusions that we can draw from this information at this time?
Yes. So, you know, we looked at the race and ethnicity breakdown, and the only group that jumped out at us was African American, race and ethnicity group. There's 21% of cases being reported from African Americans, and the population distribution in Tarrant County is about 16.8%, somewhere in that range. And so statistically, that's a significant number where we have a higher distribution of the disease in the African American population. But you heard, I think the Surgeon General was trying to explain this as well. As part of the reason we're seeing more cases occur in the African American communities due to high rate of underlying health conditions in general in that community related to hypertension, diabetes, heart disease. And that's where some of that, being prone to other illnesses comes in. And infectious diseases really impact people disproportionately when you have underlying health conditions. So that's kind of the explanation behind it, on why this is happening in our community as well.
So what advice do you have for us for how that should guide our policy decisions?
So from a COVID-19 standpoint, really that we need to tell everybody, but African American community in particular, that we need to stay at home, wear a mask, take all the precautions, and seek health care if they're starting to get ill. I mean, that's just the general guidance. It's nothing in particular that we can target. We can make things available, from education standpoint or other things, but it's really right now, protect yourself from the disease, and the best way to do that is stay at home.
Okay. So if you'll go back to the summary statistics.
Yes, ma'am. First
and
page.
This was a question that a constituent had called in to our office with, and you've explained this before, but I thought it would be good for you to explain it here in this setting, is how the individual numbers don't necessarily add up to cumulative numbers. Will you provide that explanation?
Sure. So a lot of these percentage-based numbers are based on what we call fully completed investigations. On any given day, there are investigations that are in progress. So the percentages are representative of data that we have completed. The total counts include what we call provisional data, meaning like yesterday we had 59 some reports that came in. Well, obviously they're not completed. We know there are cases, but once we get into all the details and finish everything out, that's when they start to show up on the percentage chart. But otherwise it's a good representative of what's happening. So the cumulative numbers are always going to be higher. When you hover over and look at the raw data, it may not add up exactly to the number that's shown for positive cases, and that's just routine processing of that information.
I wanted to add a thanks to you for joining us on our teletown hall that we had last Wednesday. We reached approximately 3,000 Precinct 2 constituents. Now, of course, they didn't all stay on the hour-plus-long call for the entirety of that time, but appreciate you and the other participants, Senator Beverly Powell, Leah King with United Way, and then State Board of Education member Aisha Davis. So there were some other questions that came out of that I wanted to ask. Let me double check. I don't know if there are any more specifically for you. I may address them later. Okay. Good. Thank you.
Okay. Any other questions?
Benny, on the total bed capacity, it looks like that number has increased from maybe last week.
Yes, sir.
What caused that to increase? Just
We've asked that question, and the answer we're getting is two things have changed. One, more hospitals are reporting information into the data set, so that's added some capacity.
Yeah.
And two, I think the hospitals are starting to do some surge planning by bringing more beds online into their capacity. So that's a sort of a floating number at this point, but yes, total capacity is growing.
But also remember that a lot of the patients that were in other beds, we had, do you have the slides up there that show the one that has the,
So the occupied beds are 2763, and I believe they were at some point at 2,900. So a couple of hundred have freed up there.
and what you've got is you've got people who are in the hospital for other reasons getting out.
Right.
And the fact that the hospitals are no longer doing any elective procedures means that those beds aren't being,
Yeah.
basically occupied by someone on an elective type basis. And so that also is causing the increase in available beds. And it again goes back to, as we've said for the last several weeks, we've been talking with the hospitals, and they have assured us that there were enough available beds that were prepared, and they felt like they were prepared for the surge should it hit. And this is just an indication that what they've said is still the case.
Yeah, and actually, I noticed something that I was pointed out earlier and didn't realize what the issue was. So there's actually 9 tabs, and I think in our revision, we actually dropped a box. So if you could scroll at the bottom, and that might explain, go from, yes, there you go. If we scroll, it should bring up somewhere the hospital tab. If not, yeah, there we go. If you go back to that one, we'll add that box again. I think in our revisions we dropped that off, and I think that's where you were looking for that chart, Your Honor. The how many beds are occupied, how many people are in the hospital with COVID-19, and so forth.
So if you look, again, it says up there occupied beds of 2763. This over here says that of that 2763, only 113 of them are COVID-19 patients in there, and the rest are of other illnesses. And so,
that number was 131 or something a week ago.
yes.
But your question is a little bit different. That number does impact. So 131 to 113, we've freed up maybe like 20 or so beds. But the overall bed count went from like about 4,500 to 5,700. And you're right, because more capacity has been added by hospitals, and then also more hospitals are reporting into the database. That's part of the reason.
The point that I think people truly need to understand is that 85% of the people who might be positive never see a hospital.
That's right.
Maybe 90% never see a hospital.
That is correct.
That's a significant number
Yes, sir.
of people.
Yes, sir. Most people who fall ill with COVID-19 will see a mild illness. Technically, they don't even need to seek health care. I mean, you get a flu-like illness, and if it's not serious, you stay home and you recover. But if you really do feel you need to go see a doctor and get some medication, sure. And that's how most people will go home, and they'll be told you don't even need any further treatment. Go home, get some rest fluids, maybe some Tylenol, and you'll be fine.
Okay.
Very few people end up in the hospital.
Out of the deaths that we've had, how does that compare to just the regular flu deaths that are taking place every day that are not COVID?
So for overall for our county, we've had only 29 deaths with COVID-19, and with flu we get thousands. That's unfortunate, but it happens. And they're not reportable because adult deaths are not reportable. I don't have a good number on how many we get in our county in particular. I know for the United States, on an average season, it's 36,000 But on a bad season, it can approach 70, 80,000. I mean, we get those aggregate data at the end of the year based on some estimations. So there's no good number I can give you for Tarrant County. What I can give you is pediatric deaths, because those are reportable. And this year we had at least 3 reported pediatric deaths for the flu. But I can tell you the number is going to be a lot higher than COVID-19. It's just, we have a lot more flu than we do COVID-19.
Well, but now let me be sure that I understand what you just said. You said that on an annual basis, across the United States, we'll be looking at 36,000 deaths. Thus far, on the U.S. basis, how many deaths have we had so far?
I'd have to look on the dashboard. I think we're at 21 something, somewhere in that range.
So, I mean, this is, again, we do not have the vaccine.
Correct.
But it's one of those things where you're right, where there's not near as many folks going into the hospital. Again, I think what we're doing is when they're sick, they're isolating themselves, even if there are other folks in their home. They're being very careful about that. And that's what's allowing us to flatten that curve. And then should someone come down with the illness, even with a mild case, but there are other maybe older adults with underlying health issues at home, that individual may actually go and stay someplace else in quarantine as opposed to take the risk of going back and actually infecting one of the folks one of those older adults in the home. So there's a lot of things that we're looking at right now as we go through the process. But again, as you said, I really believe that what we've asked people to do, for the most part, they're following those instructions of stay at home. If they're not at home, practice the social distancing and doing those things which make sense and will help us be able to get through this and out of this in a much quicker, hopefully a much quicker time frame than otherwise.
Yes. And if I may, I would like to again end with that epi curve. If we can get a link click. I don't want to belabor the point, but I want everybody to really pay attention to what we can do in the absence of vaccine, in the absence of any medication that actually cures. If people really follow what our leadership has told them, look at those dots and what happens to the curve right after those dots go into play. Those dots are representative of executive orders, and when people follow those, this is what we can do in the absence of any other tool. I know this is not the ideal way of doing things because we want to have the vaccine and the treatments and all that, but in the absence of all of that, we still have been able to bend the curve, and that's the power of policy that's evident, and I want to thank the leadership here for doing that for us in our county. Thank you.
I do have a few more questions.
Go ahead.
Will you go back to case characteristics? Because I missed a question. I think there is a breakdown by, or maybe it was mortalities. Maybe mortality statistics. Okay, never mind.
So, and if you were wondering about the race and ethnicity breakdown on the mortality, the data is still sort of low for us to make any assessments on those. So that's why we haven't delved into whether it's statistically significant on that or not. But on the case counts, we have enough data to say that there is a disproportionate impact. But the reason is, underlying health conditions. If mortality starts to show, I can already sort of project. There's more than just race and underlying health conditions. Age group is a big factor. As you can see, more than half of our deaths are occurring at 65 and older. We'd have to really dive deep into what age group distribution by race and things like that to figure all of that out. But age is the biggest factor when mortality occurs. We're really seeing that in higher age groups.
Is there any conclusion to draw by the breakdown of deaths by gender?
It's being reported that way nationally. I don't know why there's a male preponderance on deaths, and even with cases, everybody's, at the same risk. Maybe we don't listen well.
We don't have the good sense to follow instructions very well.
To follow instructions.
I didn't say that. Y'all did.
I know, but I mean, it's obviously showing in the data, and that's the first thing that comes to mind. We don't listen well.
Sure.
All right, thank you.
Judge,
Oh,
comment.
Yes, please.
regarding Commissioner Allen's earlier question about the statistics regarding African Americans and Benny's answer to that question being the underlying conditions that African Americans tend to face, like diabetes and heart disease, those being the reasons for the disparity in cases in the African American community. My only comment is that answer is a short-term answer. It explains short-term statistics. The overall answer is a long-term answer, and that relates to the social determinants of health that lead African Americans to have greater underlying disease pathologies in the first place. Those being access to health care, access to opportunity, access to education, access to healthy foods. All of these things are determinant of overall health disparities, and to just address underlying health conditions as the reason for more COVID activity in the African American community is to be a little bit myopic by not looking at the causal factors in the first place.
One other thing I would just say, we've had a lot of questions about the number of tests that have been performed at in the various counties. And this weekend we were able to finally get a breakdown by county, and this information that I'm about to give was through April the 8th. And through April the 8th, a total of about 97,000 tests, I think, had been taken statewide. Harris County had about 12,585. Their population is about almost 5 million. Dallas County, with a population of about 2.7 million, had 9,456. Tarrant County, with about 2.1, it had about 6,290. And the thing to remember about that also is that Tarrant County did not have the FEMA clinics where they came in and set up the screening for a 2-week period of time. Now, I believe they've now closed those down and have pulled those out, but we're 3,166 cases behind Dallas County, and they had 2 clinics, as did Harris County, which has got about, which had 12,585. So our tests, at least from my perspective, were not that far behind when you consider that both Dallas and Harris County had 2 weeks of FEMA supported clinic testing from that perspective. We are hopeful in the next couple of weeks really to begin gearing up our daily tests, and we're hoping that that will be something that will help us get a better understanding of exactly where we are in that particular process, and will give us some better information for watching the curve as we make progress through hopefully the next couple of weeks or a month. The test kits we're beginning to hear are freeing up a little bit. For the most part, the federal government is still grabbing most of the kits as they're produced, and to a great extent are telling the manufacturers where to send those kits. Primarily up until last week, most of those kits were being funneled toward New York, California, or Washington, with a little bit trickling out to other areas. We're hearing from Abbott and from many of the labs that they are, first off, they're gearing up their production, and that is something that they expect to continue fairly rapidly over the next several weeks. And at the same time, the federal government is allowing and spreading those test kits more around the country based, again, upon population. They're still looking at hot spots, and that's something that they're still focused on. But we do feel like that hopefully over the next couple of weeks, we'll be able to significantly increase the daily tests that will be performed at sites located through the county. So that's just one comment I'd like to make. And again, Benny, thank you for your work and for your efforts to this point.
Judge,
Yes, Commissioner Brooks. Hold on, Vinny. Don't get out of here that quick.
hold on, Vinny. I didn't make the statement that I made just to hear myself talk. I made it to try to get some reaction to what I said from Vinny. And I didn't get that. And I would appreciate the opportunity to hear what he has to say about social determinants related to COVID in the African American community.
My apologies, Commissioner. I misunderstood. I thought you were addressing the court for that. But you're absolutely right. I agree with your comments. You know, the current situation, and infectious disease certainly disproportionately impacting a community, is not because of the infectious disease itself. It's because of all the underlying factors that have been there already. And it's easy for us to see that underlying health conditions are causing more disproportionate impact on the community, but the longer term picture remains the same, that what got that community there are social determinants of health. So you absolutely hit that on the head. And I want to kind of put that in a broader perspective of burden of chronic diseases regardless in our community is increasing. Disproportionately, again, in African American community, but our community as a whole has more chronic diseases. And, you know, a lot of people are overweight. That leads to, heart disease, leads to diabetes. All of those type of things are increasing. And again, based on social determinants, you know, different pockets of the population get a disproportionate burden of that illness. And then when these situations happen, it comes to light that, oh, there's a problem. So you're right, you know, long-term strategy needs to be addressing the social determinants and also really addressing the chronic disease burden in our community.
And that's precisely my point, that COVID-19 has shown the light, has shined the light on the impact of these social determinants upon disease in our communities. And it's an opportunity for us to take a fresh look at what we're doing about health disparities in our community and to come up with some fresh strategies about how to deal with that. That's the end of my point, Judge.
Thank you, sir. Thank you, Vinny. Mr. Manius.
Okay, Your Honor, we have the first three items deal with COVID, obviously, and actually four of them do. Do you want to take the audience participation forms all at once, and then we'll discuss these items?
I thought what I would do is, as you discuss the items, then I've got some for item 1, some from item 2, and some from item 3. So let's just go item 1 at a time, and we'll go from there, if that's okay. All right.
Yes, absolutely. What we wanted to do as we began looking at the Commissioner's Court items is to give you some updates as it relates to COVID. You're going to hear some numbers throughout this all of these presentations. And I want to thank the county auditor, the budget director, the director of HR, people in our office. They've been working very diligently to get the best numbers that they can. And we're not quite there yet as far as the preciseness that we would like to see. So as we go and discuss the various action items under the agenda, please know that the numbers that we provide to you are our best estimates at this time. I will also tell you that we had a conference call this morning with our team that we're going to continue to improve those numbers. And so as we go through this entire process, you're going to be getting better numbers. That was one of the things that the court had asked for last week, and we are hoping to give you as much information as we have and the best information that we have in order for you to make your decisions. That includes the memo that we sent the court members I think it was last Friday, and then we also sent one out yesterday to try to keep you informed as to some of the activities that we're involved in. We're going to be going over some of those comments this morning, but I would like to ask several things. First of all, we've asked, because of things that have happened at the state level and some of the issues that happened in various departments, I'm going to ask the sheriff if he would mind coming forward and talk basically about two things. One, we now have an initial case, two cases actually, of COVID in our jail. And for one of the largest jails in the state, that's still a pretty good track record. Then also discuss the issue of the letter that we received from the Texas Department of Criminal Justice and their ability to take state inmates. Sure.
Morning, sir.
Good morning. Thank y'all for having me. For 4 weeks, we starved off any COVID in our jail, and we were the largest jail we believe in America right now that didn't have any. Well, Saturday that ended, and we have 2 COVID cases. However, we had protocols in place prior to that, and these people were symptomatic a week earlier, and they had been isolated in negative airflow cells by themselves, and that's where they were when we confirmed on Saturday that they both are positive for COVID. However, as of this morning, as they continues to be checked on, is neither inmate is presenting any signs or symptoms. They appear to be perfectly healthy, but they will stay in quarantine until the 24th of April to make sure. We're continuing the aggressive protocols of making sure that people coming into the jail are not showing signs and symptoms. And we have tested around these people, both officers and inmates, and so far we've got about 20 tests back, and they have all been negative. We have tested one of our contractors, 5 Star, has one of the contractors, unfortunately, is also positive for COVID, and unfortunately is in the hospital on a respirator. Just if you have an opportunity, I don't have their name. They've privatized that, which I appreciate, but our thoughts and prayers certainly go out to that family. And so that's what's going on in the jail with that. And we're still looking at several things. We have sent out an email to all the police chiefs and municipalities, and while we still want to conduct our constitutional duties, we're advising them that we are demonstrating a yellow flag at this point, that we do have COVID, and they need to know that. Our population right now is around 33. Which is down by almost 700 from 2 months ago, is that on Saturday we also received from Director Collier of TDC that TDC is basically shut down for a while, and in the letter indicated indefinite, and it's because of a spike of about 167 cases in the prison system, and they're just shutting down all facilities in order to try to rid the facilities of COVID. And I talked to Brian yesterday morning, Brian Collier, and his estimate is this is about a 3-week ordeal that he'll be doing that. So what we have done is prepared with our population low. Fortunately, we'll be able to withstand that. There has been a decrease in the number of chains going down the last couple of weeks because of COVID. So, but we estimate at the worst case scenario that we may go up by about 400 people waiting on them. Our staff will work aggressively with the courts to get those that are pen ready, So when they say, on your mark, set, go, we will deliver a great deal of number of people to them. But Brian said he just felt like he didn't have any choice at this point, just because of the high spike that they had. So that's what we have done. We're still aggressively protecting our people with PPE, and the community is still being very generous, and we appreciate that. And most recently, Trinity Distilleries is delivering a 55-gallon barrel with a pump on it of hand sanitizer, and we just continue to appreciate the community.
Not drinkable, that's only one.
Not drinkable, yeah. Yeah. But that's what we got, and our 3 deputies, 2 of them are recovered and back to work that had COVID. 1 is at home doing well, and we expect him to recover also this week, and he's doing great. So that's a report from the SO.
Thank you very much, Sheriff. We appreciate the job you're doing.
Judge,
Yes, sir.
I'd like to ask the sheriff a question or two, if I may.
Sure.
Sheriff, how many unsentenced misdemeanors do you have in your jail population as of this morning?
At my best recall, sir, it's going to be around 170 of them or so.
What is the problem with getting those persons released on either pretrial or personal recognizance bonds?
Well, that would be a judicial question, sir, but I'm assuming is that they are being held on bond because of previous criminal histories or violent situations that have been in their past is probably some of the issues. But I will tell you that GK's IT team, along with judicial and along with the SO, we've aggressively set up alternate hearing positions down on our level 1 where we don't have to move the person into the courtroom, and that's being utilized. And the judicial folks are trying to do a pretty good job of we're doing big jail runs every day to try to deplete that group. But that's really a judicial question. I don't have the keys to that. I'd have to have a judicial order to let them go, but I'd suggest to you that it's probably something in their past that is the obstacle.
I've been asking that we take a look at getting those persons released for about a month now, and there has been a lot of progress, but as you indicate, there's still 130 odd still in the jail population, and I'd like to see that issue addressed.
Yes, sir. I can assure you that as far as the staff and as far as what we're doing, and far as the courts, I believe, are pretty vigorously trying to address each of those situations.
Another question, Commissioner Brooks?
No, I guess that's it.
Okay.
I
Thank you
have a
very-
question.
Go ahead.
2 questions for you. If you could walk us through what is the screening process for folks that are brought to the jail, inmates, and then also what's the screening process for your team members?
Absolutely. Thank you, ma'am. Is as you come into the jail, if you're a prisoner coming in through our Sally Port, or regardless of how you get in, but it's going to be through the Sally Port, is we already have a nurse's station with jailers staged outside, and they're immediately screened for vitals right there, including their temperature and other vitals, and they're asked a series of questions to see if they indicate COVID. If they get past that, then they go into booking. But they are going to be medically checked once they're in booking also, once again. But if they, and that's for the prisoners, all of our team members, is that as they come into the jail, they're done the same way. If you go visit our jail today, which we're not allowing visitors, but if you want in, we can go.
Sure. Yeah, I think we were working to schedule that when all this hit. So.
Yes, ma'am. Is that we're checking everybody's temperature and even asking those questions again to our team members as they come in, and it's been good. We've caught several team members coming in that were running fevers that they didn't know that they were running, and we were able to send them home. But we also have available to the supervision in the jail and patrol in all of our divisions, quite frankly, is we've got thermometers, and if anybody has a hint of a temperature or any type of sign or symptoms, supervisors are checking on them, and we again sent people home like that also. Now, we've been blessed that most of those, and by the way, those people also go get tested in the first responders line, and so far so good, except for the 3 that haven't been, is that we've done all that. We're also mitigating, and we're going to have a mitigation exercise this afternoon, is that we got all the what ifs, what if this happens and what if that happens. And but very proud of our protocols that are in place. Once they were outlined and implemented, the jail commission took those and said that will be the state standard, and they've shipped it to every major jail and minor jail in Texas. And we've also been communicating with major county sheriffs across the nation with some of the things that we're doing.
Thank you.
Thank you.
Thank you, Sheriff. Appreciate you.
Y'all have a good day. Thank you.
I believe that one of the side benefits of what the Sheriff's Department is doing as far as isolation and maintaining a very strong evaluation of their inmates is that whenever the state opens up its facilities again, the people that we'll be sending down there have been with us long enough so that we can, to a great extent, guarantee that they are not infected with the virus. So that's going to help, because I know the state's going to want to get those type of people into their system as quickly as possible. So the other item that we want to talk about a little bit before we move on any action items, I want to talk a little bit about the CARE Act. And the CARE Act is most people know, is the act by the federal Congress and the federal government as far as bringing revenue to localities, and it's multifaceted. But the one area that I would like to talk about a little bit today is to tell you that the county has made application to receive our share, and we were one of the first, probably in the United States, to actually submit our application. So we've been tracking that very, very closely. If things are as we believe, there's going to be a substantial amount of money that's going to come to Tarrant County and to its jurisdiction, in other municipal jurisdictions. We have some idea of what that might be, but until some more questions have been answered, we don't know what that number is exactly. But as I pointed out in a memo that I sent you Friday, it's going to be substantial. And so once we understand what that dollar amount is going to be, we're working on budgets that we would propose to you all. The Commissioners Court is going to have to become actively involved in determining how those funds are spent. And it's something that's going to take a lot of time. And we're going to try to get experts, not only internally, but possibly externally, to help us in bringing ideas before you. One of the issues that Commissioner Brooks had raised, I believe last week, was to create a fund that we might be able to use to assist social service agencies. And we believe that the monies that will be coming through the CARE Act, there will be sufficient amounts of money to handle that particular aspect along with other aspects. So I just wanted to give you a heads up, because when this comes through, it's going to require that a substantial amount of time of the court is going to be spent on discussions on where this money should be spent. The issue with this particular revenue is that whatever amount of money that we do spend or that we do get, we're required to have that money spent by December 30th of this year. So it's a very quick turnaround. So it'll be in and out very quick. So anyway, that's something that we want you all to be sensitive to, and it's something that we're asking you to devote a substantial amount of time whenever we get to the point of how we're going to distribute those strategies.
I might just add with that yesterday, again, we've been holding general calls on Monday, Wednesdays, and Fridays of each week. And on those calls, we've had different groups that are talking about services they're providing and the increase in those requests. And part of that has certainly been around the meals and the food option. Yesterday, Meals on Wheels, the Tarrant Area Food Bank, Catholic Charities, and United Way Area Agency on Aging announced that they were going to begin a new program that would result in the weekly delivery of food. And basically, Meals on Wheels would prepare 5 frozen meals for each person in a particular location. It would be, the food bank would then include a 10-pound box of canned food, produce. It would be delivered by Catholic Charities. All of this would be helped with the help of United Way. And that's going to begin next week. It actually kicks off today. It actually kicks off today. For more information on that, it's going to be eligible for Tarrant County residents who are 60 or older and their spouse, or folks that would live within that home, I believe. But to qualify, you need to go to mealsonwheels.org, or you need to call Meals on Wheels at 817-336-0912. And this is just an effort to begin for those folks who have food insecurities. Maybe they've had folks who've been able to help them up to this point in time, but for whatever reason, they can't continue to help. And so what they're going to do is they're going to qualify, and they realize that this is going to broaden that out. It's going to cost more money. So as these different agencies begin to expand their services for the increase in demand, that's where it's going to be, we're going to have to look at that and possibly help supplement those additional costs. Part of the money that Mr. Maney has just referred to will be able to be spent for items such as this, and that's why we're going to all have to work through those requests and those budgets. I talked with some folks at Catholic Charities, and they have begun to put through some estimated budget increases that they're going to need to service the needs that they're projecting are going to be out there. And we're going to probably be talking with a lot of folks about, as I see it, it's going to center around housing, utilities, food, health care. Those are at least going to be areas that throughout this process, now while we're fighting the disease through the beginning of the recovery and all the way through the full-blown recovery, that we're going to need to be looking at supplementing a lot of the services that these agencies have provided in the past, because certainly the demand is going to be much higher than what it's been in the past. And I think that's something that, as we proceed forward, we'll be looking at, and everybody will be kind of looking at their particular areas as well as the countywide, and working with these agencies that are providing countywide services.
Judge, as soon as there are guidelines on how those funds can be used, could you provide members of the court with those guidelines?
Certainly.
We're collecting those, Commissioner, we're collecting those now, and hopefully by next Tuesday we'll have a lot more information for you. The program that the judge is talking about, we're going to add, when we get to item 2, that's part of an action item that we're going to be asking you all to consider.
Yeah, I'm aware of that, but from a global standpoint, I'd like to know how those funds that we're expecting can be used.
Commissioner, we'll make sure that we get that information to you and all the other members of the court.
GK, so if you could sort this out for me. So, because I had mentioned last week about relief fund efforts. And so what we're saying is that the CARES Act dollars would be part of that, but then anything that we need to do for right now, we still have the capability of doing that. Like, for instance, providing, expenses, backstop expenses, like what your memo
Right.
referenced. Okay.
Right. So what we're doing, we're taking action on that now, and we're capturing our expenses, not only in issues like this, but labor, equipment, PPEs, and that. We're capturing that in a cost center that Budget Department has set up, and our goal is to be reimbursed from those expenditure, from this revenue source for those expenditures.
Got
And really the CARE Act, it's very broad. And anything that we do as it relates to, or to cover costs related to COVID. And that includes health care, but it also includes social services. And so we're going to have to reach out to the community because the county will probably contract with a lot of different entities for these type of social services. And those contracts have to come to the Commissioner's Court for approval.
And that's also going to be I mean, we have to spend the money according to the regs, and that's something that the auditor's office and their their program or their grant audit are going to have to assist, and they're going to, as we send this money out, we've got to make sure that whoever we're sending it out to understands that, because it's my understanding when this is all said and done, if the federal government comes in to audit the way these dollars were spent, if they were not spent properly, then the county is the one that has to reimburse it, not necessarily the organization that we gave the money to. So it will be, there'll be a lot of reimbursement type or very specific expenditures that the money can be spent for.
And we're already talking internally about what a staff might look like to handle this alone because of the large amount of money, and that's included. We've had conversations with audit and budget and HR, and some of our other social service departments, and so we're beginning to formulate that. We simply haven't received any money yet, and we don't know exactly how much money we're going to receive. But we want to be ready to deal with it as soon as we get the money. The key is to push it out as quickly as possible, yet build in the safeguards like the judge has talked about, so that we can be assured that the money is being spent for the purpose it was intended. So.
And the only other thing that I would add is that we have to have the money spent, as Mr. Manius indicated earlier, by December the 30th, so we can expect it to be a steady stream of money going out. Because this is not going to be something that we're going to recover overnight from.
Yeah.
So we know we're going to have to probably plan on those services being provided for, I'm guessing at least 4, 6, it'll be 8 months, and we'll be spreading that money out over an 8-month period.
Okay, so then, GK, I have some more questions about
Yes,
the
ma'am.
meal delivery piece of your memo, which I can ask them now or later. We have an action item later?
We do. We have an
Okay.
action item on that particular item
Okay,
on
I'll
number
wait.
2, on item 2.
Sure.
So with that, members of the court, if we can go back to the agenda. Under the first one, this deals with the declarations of a local disaster and its amended executive orders. We do not have any information or asking any type of action from the court on this today.
I do have a couple, I have 2 audience participation forms that refer to item 1. So with that, I'm going to my first call will be to Andrew Messer. Andrew, get ready.
This is Andrew.
Andrew, this is Judge Whitley with Tarrant County, and you had asked to send or actually handed in or turned in an audience participation form for an item on our agenda. We are at that item, and so at this time I will allow you to make any statement or ask any question that you have, and then we'll go from there. The comments cannot. We ask you to keep it around 3 minutes.
Okay, that's fair. Thank you so much.
Go ahead and repeat your name and your address, please.
This is Andrew Messer. I'm at 5408 Kilpatrick Avenue in Como,
Okay,
in Fort Worth.
go ahead.
Okay, so as a resident of Tarrant County, I'm noticing a concerning trend, and that is a lack of correlation between the executive orders being passed down to us as residents and the actual hospital burden from COVID. We seem to be moving in a direction of following rules for the sake of rule following and checking boxes for the sake of checking boxes, and have totally lost sight of the goal. Does anyone remember that goal? As far as I recall, the goal of any actions taken from a municipal perspective was to prevent the hospitals from becoming overrun with COVID patients. Earlier we were taking a look at the numbers, and it looks like currently less than 2% of total hospital beds are taken by a COVID patient, and that's trending down, both in percentage and overall number. 48% of total hospital beds are occupied, just total, and that's trending down. 23% of ventilators are in use total, and that's trending down. If we have not peaked in Tarrant County, why is any real metric of measuring COVID burden trending down and not up? We know that confirmed cases are going to trend up as we expand testing, so let's focus on actual hospital burden. If we had been testing since November, perhaps confirmed cases would give us an idea of trend, but we absolutely cannot make any determinations based solely on confirmed cases because it's incredibly misleading, both because of the lack of testing and because the vast majority of people will only experience mild inconvenience from the illness. We don't really care how many people get it per se, we care how many need to be hospitalized. And I'll give you an example. The XFL, if anyone remembers Vince McMahon's venture into football, is filing bankruptcy and hasn't played a game in a month. But if I asked 1,000 new people per day if they've seen an XFL game, and then I put that number on a chart, it would look like their popularity was skyrocketing in the midst of filing Chapter 11. The more accurate way to look at this would be to look at actual ticket sales, like how many people are in the seat. That is, how many people are in hospital beds. What is that number? What is that trend? Nothing else is really reliable at this point. And by all accounts, that number is trending down. And in fact, I'll note, in an ideal world, every single person in Tarrant County would get the virus, preferably asymptomatically or with mild symptoms, because that in itself is a vaccine. So the more confirmed cases we have, as that curve is skyrocketing, with virtually nobody going to the hospital, the better. And my concern is that the public discourse has completely outkicked the coverage. We've lost sight of the goal. And the goal is to make sure hospitals can do their job. The goal is not to unnecessarily drive businesses out of business or away from Tarrant County. It is not to tell kids that they can't play in the park. It is not to tell my grandparents that they can no longer see their grandchildren. And it is not to tell the guy or girl struggling with addiction or depression that they can no longer connect with their community and leave them alone with their thoughts indefinitely. These may be necessary steps towards the goal, but they are not the goal in and of themselves. The goal is to make sure hospitals can handle the COVID burden. And my position is, at this point, it's incredibly clear that they can. And if Tarrant County is showing in the models a point of overburden, I wish that they would publish those models, and far more importantly, the raw inputs that go into the model, so that residents of Tarrant County can verify them. And I hope that they are not just navigating to a website for an estimate on where we're at in the curve without any examination of the data going into the model. Because if there's one thing we've learned from the COVID response over the last few months, is that the models have been horribly wrong, week in and week out. And in conclusion, my hope is that Tarrant County creates some sort of commission or body that can address the public and give them definitive answers on how their actions are affecting the number of COVID patients in the hospitals. And furthermore, to directly correlate that with any legislative action that's being taken.
Andrew, thank you very much for your comment.
Thank you.
Next, I will be calling Bradley Bell.
Hello?
Mr. Bell, this is Judge Whitley. You had indicated that you would like to make a statement or participate in item 1 of our agenda today, A1. We are at that point, and so if you would please state your name, your address, and you can make a comment. We have limited that to approximately 3 minutes.
All righty, thank you. Appreciate it. My name is Bradley Bell. I live at 5739 Cancun Drive, North Richland Hills, 76180. And I just wanted to voice my opinion as a resident and a voter. That myself and I know a lot of others who have been laid off, they've lost jobs, or they're running out of work. And we sure don't want to see this shelter at home extended. And we'd like it, if possible, to get back to work as soon as possible, even earlier maybe than April 30th. We know you're trying to do your best, and you got people telling you how to do your job left and right, but I just wanted to make that known. That was really the point of my call.
Thank you very much, Mr. Bell. We appreciate your comments. I'm going to go ahead and hang up now, and then I will make a comment and give our commissioners any opportunity to make any comments they wish. Thank you.
Sure. Thank you. Again,
in listening to both those calls, I think there were similar. I think that our goal is to do everything we can to lessen the spike, to stop the spread of this COVID-19. We're listening very closely to our healthcare providers, our hospitals. Yes, our hospitals have assured us that they felt like from the get-go that they had the bed capacity if this really spiked and we got in anywhere near the same situation that New York or some of the other areas have experienced. From Mr. Tanasia's comments earlier today, I do believe that we are making progress toward bending that curve, and I think that our folks are doing a very good job, for the most part, of practicing the social distancing, staying at home. If they are at work, then when they get finished with work, they're going home. And I hope very much that with this, cooperation and participation, that we'll be able to begin to relax and to lessen those restrictions as we go forward. I feel good where we are right now with regards to the folks who have had to go into the hospital. But I don't think we can rest too much with that. I think we have to stay the course, and our numbers are still, today we added 59 new cases. Yesterday we added 76 new cases. Those numbers are still high, and what we're trying to do is to make sure that we don't see a big spike and therefore potentially put more and more folks into the hospital.
Judge, I think we're in a situation where if this ends with a whimper, and I think that's what we really want, then it's going to be said that we overreacted. If it ends with a boom or a bang, it's going to be said we didn't do enough soon enough. So it's kind of hard to win. But let's hope it ends with a whimper. So,
Commissioner Allen, do you have, or Johnson, or Commissioner Brooks? Commissioner Allen, do you have?
Yeah.
I was trying to give them time to respond.
Yes, sir. I think that your remarks were right on point. We need to listen to the medical experts and follow their advice on how to navigate our way through this pandemic. We are not through to the other side yet. The medical advice is to stay the course, and I, for one, intend to follow the medical advice.
I did have one other comment from Devin Pipes, and I'll read this before then. And it's regarding the executive orders, COVID-19. In the opinion field, the comment is, these recommendations come from State Representative Matt Krause and are intended for Governor Abbott. However, I think they are all great ideas for Tarrant County to consider immediately. Remove distinctions between essential and non-essential businesses. No prohibitions on public gatherings, including religion services and public parks, but must maintain social distancing and adhering to CDC guidelines. Open restaurants, gyms, salons, and similar businesses, again, must maintain social distancing and adhere to hygiene standards. For example, restaurants should space out tables, remove shareable items, then continue all waived regulations for 6 months, continue shelter-in-place recommendations for those over 65 and those with underlying health issues. All Texas schools should remain closed for the remainder of the school year. Focus should be on getting ready for 2020-2021 academic year. Continue prevalence of testing. This might be the most important aspect. The more we test, especially for antibodies and immunity, the better we can adapt to certain situations. Mr. Allen?
Yeah, I just wanted to thank those who called in or who emailed in with their questions or their perspective. I agree with much of what's been said. I think we have to continue to approach things from what's the big picture. And in that, obviously, at whatever point that we move forward with releasing any restrictions, is that we have to be able to say with extreme confidence to our community that here's why we believe now is the time and here's how we can ensure the safety of you and your family. And obviously we're not to that point yet, but we certainly should be preparing to move in that direction, which I know conversations are being had, and I can understand people wanting to return to normal or whatever that new normal is going to be. That certainly came through in the town hall that we hosted, that folks either felt like as a county that we were overreaching and we were doing too much. Others said we weren't doing enough. So it is a delicate balance to strike, but obviously we have a responsibility to do that, given that we are dealing with the global pandemic and we're dealing with the potential loss of life, and for 29 Tarrant County residents thus far who have lost their lives and their families are greatly affected. So somewhat to that point, in regarding this item, I know we're not taking any action for it on the agenda, but to follow up on some requests that I made last week, particularly regarding testing and also in evictions. And so, GK, I'm not sure if that was part of the update that hadn't been provided yet, but I'd like to hear where we are on including those or some measures related to evictions and testing in our order.
So I think that we've heard this morning about how we're expanding our testing capabilities. We're not where we want to be. There's a lot of reasons for that. It's not just the issue of finances. It's the issue of availability of testing products that we need to have in order to test. I think that the judge talked a little bit this morning about the number of tests that we've done. I think if you would chart that out, that's increasing substantially. I think the one thing that people need to understand, regardless of the number of resources that we believe that we can currently get, the testing will still be limited, and it will be limited to those individuals that show signs of the virus, those individuals who work in the hospitals, those individuals who are other healthcare providers, and then obviously in the third level, which is a CDC recommendation, all three of those are our first responders. And the goal of that is to make sure that, especially on the first responders and the hospital workers, that we get them back into the system as quickly as possible. We have been working with different groups, private sector groups and companies that we believe that will give us some ability to do more testing. Obviously, the money that we're getting from the CARE Act will give us much more revenue to go out and do more testing. But at least for the foreseeable future, that testing will be limited to those categories that we're talking about. So, Judge, I think you talked about the number of number that we did. We
Yeah.
did over 6,000 tests.
And I will add that I do believe that as we begin to ramp up our tests, that there will be the ability to move down that priority list and to, again, as GK indicated, you will have to be screened, and it will have to be determined that you have symptoms that necessitate or warrant testing. At that point in time, in our process, what will happen is once you get to that stage and it says, okay, yes, we want to test you, there will be a pop-up that will say, here's where you go and here's the time you go to be tested, as opposed to any situation of where I've got some symptoms, I think I'm going to get in line and see if I qualify to be testing. So that's one thing, and we believe that beginning next week, we'll be standing up some additional sites. There are actually 23, as best we can tell, and as identified by public health, about 23 different locations that are testing right now. Now, many of those are just testing their employees, or just testing the patients who are maybe fixing to be admitted to the hospital, but there are probably 6 or 7 sites that once you go through the screening process, you can be tested without necessarily being one of those. You still have to meet the CDC requirements of testing, but you could then be tested without being in one of those categories. And these are basically some of the urgent care facilities, total care facilities, the more private sector type of facilities that are out there. We believe that next week we're going to put up at least maybe 2 sites that will be able to test. It'll be more along the lines of the priority that Mr. Manius outlined a few minutes ago, but we do think that there will be some availability to folks, again, moving down the CDC that are not just getting ready to go into the hospital employees or first responders.
So then, and obviously, you all are providing this explanation during our court meeting, but where is that for the public to access it, to understand who's getting tested and how that's being prioritized?
We do not have it on our website. We can put it on our website.
I think that'd be helpful.
Okay.
I mean, I think everyone is starting to understand and accept the realities that not everyone who wants a test will get a test. But to the degree that the community is still concerned that we're not doing enough testing, which we acknowledge that we're not, and we are also acknowledging the limitations that are associated with that, we know that. But if they don't know that, then it's somewhat contradictory for us to tell you to stay at home and do your part. We got to make sure that we're doing our part in explaining to them, the entirety of the situation. So.
Understand. Thank you. As it relates to evictions, we've reached back out through Judge Evans to our Justice of the Peace to make sure they understand the Office of Court Administration guidelines as it relates to evictions. I know also that Patricia is working with Catholic Charities and the cities to see what type of relief that we can provide, or at least encouraging our apartment owners and the people that rent properties that they need to really just kind of back off right now, because there is help coming not only from some of the different funding of the CARE Act, but there's also some CDBG money that's been made available that we'll be utilizing to help offset some of those also. The most important thing is through the JPs, because the extra monies that we're getting from CDBG, and I don't know if it's for supportive housing or not, but it's just $1 million to a couple $1 million, and that doesn't really go that far.
So then the money that we provided through Housing Finance to go to Catholic Charities, that is being directed for rental assistance, right?
Yes, ma'am.
Okay, great, because I know there was initially some confusion on that. Okay. But then last week in court, I was told that there would be some, information from the DA and on us addressing evictions in our order, but I haven't received an update, so.
Can we, before we get that update, could we take about a 5-minute recess?
Works for me.
Thank you.
Okay, so I believe, Leslie, that you were going to address my question about evictions. Thank you.
Yes. Yes, good morning. To address your question regarding evictions, Commissioner Allen, the county judge does not have the authority to control evictions. That is a function of the judiciary and the Office of Court Administration. But there has been action that's been taken relating to evictions. The Supreme Court of Texas has issued a mandate that halts residential evictions, and then the JP courts of Tarrant County have also issued an order that suspends eviction hearings, both commercial and residential, except in very extenuating circumstances that's outlined in the order. So it is being addressed, but the easy answer as to why it's not addressed in the county judge's order is because he does not have the authority to control those hearings or to order landlords to cap fees related to evictions.
Very good. Thank you.
Okay.
Is that it?
That's it.
May I comment, please?
Sure.
As I mentioned last week, whenever this pause on evictions is lifted, we are going to have we're going to open a floodgate of people being evicted from their homes, thereby creating a new surge in homelessness in this community. I would like to ask that we direct GK to have our community development and the housing department, which falls under community development, to develop a plan of how we're going to address this tsunami of evictions that's going to come once the stay is lifted.
Commissioner, I would hope that as a part of the looking at the stimulus package that Mr. Manius talked about earlier, that we as a court, working with not just the housing finance or housing area, but also with the Homeless Coalition and with a lot of other organizations, will be looking at how we help folks in the coming months, not only from a housing perspective, but utilities, food, health care, all of those different things that people are going to be, that some are in need of now, but certainly in the future many others will be in need of, and that is a part of what these stimulus funds that we're going to be receiving will be allocated toward. And so maybe it won't, I'm hopeful that folks won't be just totally not paying rent, but that if there might be a deal worked out with these both rental properties as well as apartments as well as long stay facilities might consider some sort of a discount or something, because I don't think at the end of this deal, whenever that might be, that these landlords are going to all want to have to evict and then re-rent their properties. So the ideal will be, hopefully, being able to convince them to discount or certainly waive late fees and do things like that will allow individuals to stay within their apartments, their homes, their rooms, whatever it may be, because like you said, there may be a lot of people and we're just going to be swapping and moving people from one location to another. So I hope that in the coming weeks, pretty soon, that we begin to address that and begin to have discussions with our apartment associations and other folks that will do that. I know a number of folks that I've talked with said that when they first lost their job, one of the first calls they made was to their landlord, to their, if they were financing an automobile, and that they found these people to be reasonable and understanding. Now, that doesn't mean everybody will be, but I don't think anybody, if they could get a little bit during this time That may be more than what they were expecting to get, and I don't think they want to have to go through that process. But again, I think in the coming weeks, this court is going to have to be very involved, as Mr. Manius mentioned earlier, in getting with associations that are helping folks, whether it be in the homeless, whether it be in the food, whether it be in the health care, whether it be in child care, a lot of different areas. So I appreciate your comment, and I think we're just going to have to begin to be ready to look at that.
Commissioner Brooks, this is GK. We'll go ahead and start the planning or the development of some plans and strategies as you requested.
I think another.
Thank you, GK. I feel a lot better with a plan than with just hopes and dreams.
Yes, sir.
Well,
I think another important part of this is that we work with those JP courts, and we gain a whole lot more if we can solve this problem prior to eviction,
Yeah.
so that they don't have to get out on the street. We're so much better off if we can solve this problem while they're still in the home.
I agree, Commissioner. Commissioner Allen?
And so do I, and that would be part of a plan.
I appreciate your comments, Commissioner Brooks, and my other colleagues. And I know that Patricia's team and others are working on this issue. So I certainly don't want it to seem as though my question is suggesting that nothing's being done, because I know a lot is being done. But it's good to have a formal answer on us addressing that in our order, because I've had calls and had many questions from constituents about it, not just from residents, but also from business owners who their business happens to be providing housing. So we have, diverse constituents that we need to be serving in our efforts. I would say by and large, from what I'm hearing, is that people are doing everything that they can to pay their rent. So I want to be really clear that we're not painting a bad picture of who these people are. Obviously, some of these people have existed for years and years and years, minus pandemic, where they just struggle to pay monthly bills, even with many efforts to find additional work. Of course, there are some bad actors. There are everywhere in pretty much any instance. And no one has to echo this, but I've been evicted before, and it's a traumatic experience. And obviously, the last thing that we want now or in the future is because of this pandemic that we have folks who are searching for housing. Moving in itself is a traumatic experience. It's considered a major life event. So to the degree that we can lessen the trauma of what has already been a very stressful time for everybody, we definitely need to be doing that. So I look forward to, I don't even know how many times a week I call Patricia to ask her one thing or another related to housing, or we email. So I appreciate the work that's being done, but if we see that there is an issue, to whatever degree that we can be proactive, we have to do that. So
Absolutely.
I guess the only comment I'd make is you indicated that there's something that we should put in the order. And again, in my conversations, okay, I thought I understood.
No, I got my answer.
Okay.
So, yeah.
Okay.
Yeah.
So
Go ahead.
we're going to move to item number 2, and there are 2 issues that we want to address and ask the court's approval. I know that we have several audience participation forms, Your Honor, so let me just state which the
I
two.
have 2 for item 2. Do you have more than that? I have 2 for item 2, and then I have 1 for item 3. So I only have, 2 for item 3. So I have 4 left.
That's correct. That's
Okay.
fine. Okay. So the items that we're going to be discussing and ask action on are really twofold. One is a subscription to QuickBase as it relates to public health, and the second one is the item that we've been discussing as far as a backstop for this food program. And I asked Kristen to come up upstairs to give a greater detail of that. But would you like to go ahead and call those individuals to see if they have comments before we ask for any formal action?
I'll do that. I'm going to first call Pamela Young.
Cindy. Send me an IT guy. We got one. Not able to open this.
Por favor, deje su mensaje para 46986
Rachel, come in here.
741117.
Pamela, this is Judge Whitley. If you're on the line, or if you could call me back, please. I'm not sure exactly. What number do we have them call back at?
I don't.
I'll try to call you again in a moment. Pamela, if you can be available at that point in time. Thank you. I'm now fixing to call Divya Babula.
Yeah.
Yes.
Divya,
Yes.
this is Judge Whitley. You had called in an audience participation form on item 2 of our agenda. I'm returning the phone call, and if you would like to ask your questions or make a comment, please start off by stating your name and your address, and then you have about 3 minutes to make comments.
Great, thank you. Hello, everyone. Thank you for the opportunity to speak today. I'm here on behalf of ICE Out of Tarrant County Coalition. Our mission is to ensure the protection and empowerment of immigrant communities in Tarrant County. And today we're here about COVID-19. This is a global and local pandemic, but as we know, not everyone is affected the same way. Our concern today is about how ICE has been continuing their egregious and unsafe practices of arresting undocumented immigrants at hospitals in various places around the nation. And we are hoping here that Tarrant County can play a key role in making sure that all communities feel safe. We think that this kind of practice by ICE should be put to an immediate halt while we contain and reduce the spread of COVID-19. According to official ICE guidance, ICE can only conduct enforcement operations at medical facilities under extraordinary circumstances. And while we fundamentally disagree that these operations should occur at all in medical facilities, this especially should not happen during COVID-19. And despite their official guidance, there's clearly inadequate oversight and transparency around ICE enforcement or uneven application of this, that communities are not feeling reassured by their decision makers that they can safely seek medical care at this time. The mere possibility of arresting undocumented immigrants at hospitals will worsen the sense of paranoia and fear that is already present within immigrant communities in Tarrant County, discouraging them from seeking medical help if they suspect they might experience symptoms of COVID-19, and this in turn increases the spread to all communities in Tarrant County. We don't believe that Tarrant County can achieve its goal of reducing the curve or flattening the curve and keep all communities safe without implementing some emergency provisions that ensure that ICE enforcement does not take place in Tarrant County medical facilities and actively commit to putting public health first. We think that these commitments should be made clear to the immigrant community that is so integral to the county. So we're calling upon the Tarrant County Public Health Department, the Commissioner's Court, and the Sheriff's Department to adopt a few emergency provisions such as that ensure that ICE doesn't have a presence at medical facilities during the pandemic, to communicate what measures are being taken clearly and regularly to all communities in Tarrant County so that undocumented communities feel comfortable seeking medical help during this pandemic without the fear of family separation. And these communications should be made through the Tarrant County Public Health Coronavirus website, news outlets, and other forms of public outreach. We would also like to ensure that the Tarrant County Public Health Department does not disclose or require patients to disclose their immigration status of any patient seeking medical help during the pandemic. And we would also like to see that medical staff and workers at the hospitals are educated on immigration issues and ICE's sensitive locations policy and are prepared for any potential interactions that might occur as a preventative measure. For example, designating staff members who will be the only people authorized to speak to immigration or law enforcement
Divya,
agents.
you need to begin to kind of wrap up your comments.
Okay, definitely. Creating an alert system to respond to requests are some examples. Our ultimate goal is that all persons are welcome in Tarrant County medical facilities regardless of their immigration status, and we look forward to discussing these demands and our concerns with you as you know how to get in touch with us. Thank you.
Thank you. Thank you, Divya. I would just make the comment that I have had no indication whatsoever that there has been any ICE agents at any of the hospitals, any of the public health, or any of the other in places where there would be tests conducted. Again, we do not have any control over ICE, but I do know that our sheriff's department has certainly not had anyone looking for this, at any of these locations, checking on documentation from that standpoint. And I'm not sure, Vinny's not here, but I don't believe that there's any questions on any of the surveys that we've seen to this time that have any questions about citizenship status. So I do very much, Divya, appreciate your comments, and I want to thank you for calling in, and certainly will take that into consideration. Now I'm going to try to...
Before we move on, just a heads up, Divya, if you're still listening to the meeting, is that I'd like someone on our team to contact you because you had a number of kind of concerns and provisions, and I wasn't able to capture that all. But if I do remember correctly, that you had mentioned that things be communicated to a diverse community. So obviously the public health department has information translated in Spanish, and I realize that's not the only perhaps language that needs translation. I'm not sure yet what all our hospital district has in terms of translating the information that they're providing, and that was a question that I had prepared to ask a representative had they given their update today. But so, Divya, just a heads up, someone from our team will be contacting you to get your list of questions and concerns. Thank you.
Judge, I think Vivia made some good points that we need to make a clearer statement to our community that our priority is to provide health care to those infected by COVID-19 and not to engage in any ICE-related activities. We don't need anybody in our community infected with COVID-19, but afraid to get medical assistance because they think they might put themselves in danger of being deported. This is a community-wide public health concern. We want everybody who is infected to be able to access treatment, or else all of us are in danger.
Thank you, Commissioner. I'm going to try to call Pamela Young back at this time.
Hello?
Pamela.
Yes.
This is Judge Whitley. I must have dialed the wrong number the first time. I apologize for that. You had indicated that you wish to speak during our court this morning on item 2 of our agenda. So I'm calling you at this time. If you would please state your name, your address, and make any comments. The time on your comments need to be around 3 minutes.
Okay, thank you so much. My name is Pamela Young, and I live in Fort Worth in 76111. Last week, and just a few minutes ago, both Commissioners Brooks and Allen brought up hardships that Tarrant County renters and tenants are facing in light of this pandemic. The suspension of eviction hearings that the Texas Supreme Court and Tarrant County have enacted are great first steps. However, they do not go far enough. Also, the financial assistance that is available to some through federal and private dollars is not available to all for a myriad of different reasons. Some may owe child support, others may not have a social security number, and others still simply may not receive assistance in time. For instance, if you did not file taxes in 2018 or for 2019, there will be considerable delays in receiving financial assistance from the federal government. As a renter who has lost part of my income during this pandemic, I'm asking you to consider adopting a grace period ordinance. That would provide, at a minimum, a 60-day grace period for tenants to catch up on any missed rent payment due to COVID-19 before a notice to vacate is issued. Reports are already rolling in to agencies like the Texas Tenants Union that Tarrant County residents are currently being threatened with eviction. This is unacceptable, especially at a time like this. April's rent is past due, and May's rent will be due before we know it. We are all impacted in different ways, but we know a majority of people are being impacted financially. Missing one paycheck or more can put people far behind, and we cannot simply depend on landlords to have a heart. We need a guaranteed measure that will not only protect us from being evicted, but that will allow us more time to catch up as this crisis is sure to continue. Will you adopt a grace period ordinance to add additional protections for tenants from eviction during this time of crisis?
Pamela, thank you. I'm going to ask our district attorney's office to approach the mic and indicate, I believe that we do not have that authority, but I'm going to ask her to come forward and respond to your question.
Your Honor, that is correct, that you don't have the authority to do an ordinance that is within the jurisdiction of the city.
Okay. Did you hear that, Pamela?
I did. It's within the jurisdiction of what now?
Of the city of Fort Worth.
So they could, by ordinance or by request, basically put in place a grace period?
I can't speak to that specific point, but the cities, not just city of Fort Worth, but Arlington, other cities and municipalities, that's who's authorized to enter an ordinance that then has the effect of law.
Okay.
So there's no type of ordinance that the county could issue to this effect?
That's what they're saying, because we have no ordinance making authority.
Okay, well, I just want it to be on record for City of Fort Worth officials, if they're listening. They instructed me to come to the county for this, so now I will be going back to Fort Worth City officials. Thank you very much.
When you go back, would you go ahead and get the name of the person who sent you to us?
I can tell you right now, if you'd like me to, several, but I won't do it like that today. But I'll let you know via email.
Go ahead and give them a call and say, next week I'm calling the judge back. And we'll see where we go from there.
Will do. Thank you so much.
Thank you, Pamela. Have a good day.
All right. You too. Bye-bye.
So we're going to ask for two action items first. On the first one, we're requesting that the Commissioners Court approve a quick base subscription for public health. And this is for a 3-month subscription. The cost of that is $10,080. This is something that Judge Whitley has signed an agreement, and we're asking for approval and ratification.
Move for approval.
Second.
We have a motion and a second. Questions?
Okay, what is this again?
This is called QuickBase. What it is, it's a software that will allow our epidemiology division, as we contact individuals to talk to them about the fact that they've tested positive, that we're able to generate data from that to enter into that software, and it'll automatically populate those fields. That way we can do analysis in the future, and it gives us a tracking base. We've talked with IT, and they agreed that it's a cloud-based software, and IT is fine with the software also.
Any other questions? Okay, Judge Whitley votes yes. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
Okay, the second item deals with the Meals on Wheels program. Judge Whitley talked a little bit about it. Basically, what we're asking the court to do is to provide a $50,000 backstop funding as it relates to the collaborative meal delivery program. And it's my understanding that the AAA is providing $2 million in funding for food. If you have any additional questions, one of our staff members is here to answer those questions for you.
I have questions. So,
Can we go ahead and get a motion or a second first? And then
I move approval.
Second. Okay, so with the meal delivery program, and really, GK, this is an ask for part of your memo that you'll be providing us regularly, is to have a. Okay, let me go back. So I understand that there are many organizations that are seeking to provide food and are doing food distribution. So we have, right, like our infants who need formula. We have our K through 12 that our school districts are serving. We have our seniors. But so that's a big gap between 18 and if you're a senior, which I know that those needs are being met to the fullest degree possible, but it would be great to see who's doing what by age group. I understand this item is related to 60 plus. And I know that Meals on Wheels, obviously, that they serve, what their traditional mission has been as an organization. It's a great organization. And then, of course, what they're doing now. But I'd like to have an understanding of the breakdown by age group and where the gaps are, and then also by geography, since we don't have an integrated transportation system, and many of the cities in our county have no transportation options, are very limited, and I'm not sure what they look like now, especially given that some of them would require people to not practice social distancing. So really just trying to get a sense of where the needs are being met and then where the gaps are. And then,
Commissioner, one of the things that I would, again, suggest, and we've talked about it a couple of times today, is the stimulus dollars that we hope will be here soon. And I think we're in the process of, again, listening to the demands that on that general call that, again, we have Monday, Wednesdays, and Fridays.
right.
But I think now is the time for, as a court, maybe hopefully in working in partnership or collaboration with the cities, both Fort Worth as well as Arlington to some extent will be receiving funds. Some will come from the CARE Act, some will come through CDBG. But that we need to begin to work toward that, and listening on the calls thus far, there has not been an outcry for for food. That doesn't mean it's not out there.
Sure.
But it means that I think now is the time to begin planning, and hopefully within the next couple of weeks, we'll begin to see some of the stimulus money that we all think is coming this way.
Yeah.
And so I think it's important as a court, hopefully in conjunction with these agencies, whether it be folks that are the food banks, whether it be Meals on Wheels, but that it would expand out to fill. There's going to be needs between, as you just pointed out, between the high school seniors and the seniors. And I think that those are all things that we've got to begin to try to put together and address. And I think that's something that this court's going to have to be very active in and a part of with the different agencies that we're talking about.
Yeah. Well, and here's an example. So in talking with Deborah Coppola, who's the executive director of Arlington Charities, and they've been doing the big feeding program at AT&T Stadium, is they are doing the best that they can and are maximizing the resources made available to them, and, you know, from a generous community, but they need gloves and they need masks in order to continue the feeding program for the safety of those who are recipients, and then obviously for the volunteers that are there. And then and as I talked with her just yesterday, she said that they have some limitations on the food supply, which that may not necessarily be part of a greater issue, at least not yet, and hopefully that won't become an issue, but just in connecting her with resources so they have diverse options to provide people, you know, with a healthy option. So, like, that's just a one-off that is, we talk about it to some degree on our calls, but just in kind of digging deeper. So I just want to make sure that we're, to your point, that we're thinking ahead as much as we can and providing those needs as they become apparent.
Sure. And Commissioner, you would ask her to reach out to our office. Maybe
Sure.
we can do some short-term relief, but those type of issues are something we would hopefully use the CARE Act funds to address.
Great.
Again, I really think that we're going to need to have groups together that are going to address and to communicate with all of the agencies throughout Tarrant County for housing, for utilities, for food, for health care, and that's in transportation to any and all of those deals. There's been a lot of folks who volunteered to deliver the food, but specifically, I mean, I thought of Tilly out in Arlington. She definitely ought to be a part of it. Six Stones, Grace, CEC, organizations all over the county. Those are the things that we need to begin bringing together, and that's where the court, I think as a court, we're going to have to, you know, basically look at dividing those things up and saying, okay, we're going to get in. But we need to begin asking them. I was talking with Catholic Charities this morning, and Michael Grace there said, you know, they've already put together their budget for the rest of the year. And they're beginning to, just based upon current needs, define what they think their shortfall will be. And I think we have to ask all of the organizations to begin planning and begin looking from now until the end of the year so that we can gauge how that money is going to be spent, and then again challenge the community to add to that, especially in the areas of food banks and things like that. You know, a daily or a weekly, this is what we need this week or whatever, but that's something that I think each one of us are going to have to be a part of, either within our areas or within a specific one of those things that we talked about.
Sure.
That's something as a court we need to kind of think about and figure out how you want to do that.
Totally.
Mr. Allen, do you have any other questions?
No, if there was anything that Kristen wanted to add. No, okay.
And not if there are any other questions. I'm available offline as well.
Yeah. Kristen's been leading this effort for us, so if you have any additional questions, just give her a call or give us a call. So we're requesting that the court provide $50,000 as backup funding for this particular program.
We have a motion and a second. Judge votes yes. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
Okay, so on item number 3, the This concerns leave and pay options as relates to the pandemic. I know that we have 2 audience participation forms, Your Honor. If you would like to hear from them before we start our discussions on this.
You bet. I'm about to call Benito Mendez.
Please leave your message for 817-856-7183.
Zanotto, this is Judge Whitley. I was calling. You had expressed an interest to participate in the, when we got to the discussion on item A3. I will try to call you back in just a few minutes. The other item is Rebecca Ellinger, works with the Tarrant County Sheriff's Office at home for medical reasons. Wanted to speak does not wish to address the court, but says subject matter leave policy regarding COVID-19, family first. Doesn't necessarily want to speak during the court, needs clarification regarding county's participant will return to work. Will return to work Wednesday. If not eligible under the act, please contact. So I'm going to try NATO one more time.
Hello.
Zanetto, this is Judge Whitley. You had expressed an interest to make a comment regarding the leave policy options under COVID-19. So we're at that point in the agenda, and I will ask you to please state your name and your address, and then you have 3 minutes to make whatever comments you'd like to make.
Okay. My name and my address.
Yes, please.
Bible Mendez, 4948 South Street Drive.
Okay, now make any comments you'd like to make, sir.
I'm sorry, I did this in error.
Okay, well, I thought you, okay, we apologize, and I thought you had called wishing to make some comments. So thank you very much, sir, and have a good day.
All right, thank you.
So on this particular item, we're going to go ahead and ask Ms. Worthy to begin to address the court on this issue. Also, there was the information that we sent to you yesterday afternoon had some data in it. I think we included a copy of that communication in your red folder also, so if you would like to refer back to any of that, then please do.
And I have copies of our documentation if anyone needs it. No? Y'all ready?
Yeah.
Good afternoon. So we're tag teaming this. It's my turn this week. So I'm here to discuss with you and obtain decisions, the leave and pay options. Some of these decisions are related to, regarding extensions or the elimination of pay plans that you've previously approved. And other decisions will be about the administration of the Emergency Paid Sick Leave and the Emergency Family Medical Leave Expansion Act, both under the Family First Coronavirus Response Act, which was mentioned by the caller earlier. Let me kind of just summarize real quickly what has been approved so far. So far, the court has approved pandemic time off for those individuals that are at home and not working. So we have given the responsibility to each appointing authority, which would be a department head or elected official, to determine what are essential functions and then identify the individuals that will be performing those essential functions either on site or by telecommuting. So those individuals that are off work and not working at all, but on call and available, are receiving their full pay at pandemic time off. Additionally, hazard pay was approved, and that was for non-exempt employees that are reporting on site and working during this time. Both of those were put into effect on March 22nd and are effective through today. The court communication and the documentation has most of the same information. There are a few things that have changed. We've highlighted those for you, and I'll discuss them as we go through those pages.
Why don't you tell us every time you switch pages and show us what page you're on?
Yes, sir. So I am on, I'll start with page 1 that says the Emergency Paid Sick Leave, and it outlines that act. There are no changes on that page. When we go to page 2, and that is continuation of the Emergency Paid Sick Leave Act, under compensation, we have added another pay type that is included in the regular rate of pay as determined by the FLSA. You might remember we've discussed that that's not just base pay, but it includes shift differential, field training, hazard pay, and out-of-class pay would also be considered in that. So that is new information from last week.
And that's this, I know I'm...
Yes, you have the right document, sir.
Right here.
Yep.
Can y'all see that? Roy, JD?
It's on page 1, decision.
It's on
page 1, it's at the very top, it says Emergency Paid Sick Leave
Yes, sir.
Act.
That is correct.
It's also in the court communication.
It's in your court communication. It's right behind the first page where we outline the action.
Okay, and then we're now on page 2 that starts at the top with prohibitions.
Yes, sir. And you see there is a highlighted section on that page that just outlines that out-of-class pay is included in the regular rate of pay calculation.
Okay.
As we move forward, we'll talk about that more. If you move to page 3, which at the very top says reasonable notice, but we're moving to the section of the Emergency Family Medical Leave Expansion Act, you might remember that that piece is for child care, and the discussion previously had been that it was for child care of individuals or children that were 18 and under. But additionally, children that are over 18 that are incapable of self-care because of a mental or physical disability would be included in this. So if an individual had an adult son or daughter that was incapable of care, then they could invoke the act for that reason.
Well, and was this additional guidance that came in since Tuesday?
Did that come additionally from the DOL, or was it something that we
mentioned it verbally last week.
Okay. It was, okay. Yeah, we have continued to get updates, and truly, we often look at each other and go, okay, let's talk about what this part meant again.
Sure.
It's a lot of details in this act.
Again, this emergency and family medical leave does not even begin until we stop.
That is correct. So both the pandemic time off and the hazard, well, mostly the pandemic time off, has delayed our activation. However, the act went into effect April 1st. So we have had some employees that might have tried to invoke the act prior to that, but employees will probably begin to invoke that once that pandemic time ends, because that would be what would be available to them next.
So basically, all the time, as long as they're on the pandemic time off deal, we're paying them, they're not taking it out of any buckets. And then once we stop that and we begin the emergency paid sick leave part, then we continue to pay them. They continue to not have to take it out of their buckets for at least 2 weeks.
80 hours, yes, sir.
Okay.
For those that qualify.
For those that qualify. There's 6 reasons which they qualify, and we'll talk about those, but there are the 6 reasons that they qualify, and of course then the family medical leave piece also tags behind that, which only has one qualifying reason, and that's child care. Okay. So we've now moved to the decision page. Okay. And on the decision page, it also starts with number 1, but at the top it says decisions. There are some highlighted dates there, and that's having to do with the fact that both the pandemic time off and the hazard pay was approved through today. So the decisions related to that under pandemic time off would be to extend the pandemic time off for some defined period of time, or that time could end. So let's talk a little bit about the extension of it. You all have been extending that in increments of either 1 to 2 weeks over the last few weeks that this has been going on. And so if you wanted to extend it, obviously we could talk about extending it to another week, or I would say if we are going to talk about actually eliminating it, you might want to consider at least extending it to the end of this week to give departments time to prepare and make plans for those employees that have been home and may want to pull them back in or be able to send them work at home. So that might be a consideration. Under option 2,
now, before we,
yes, sir.
At what point are we going to discuss the dollar consequences of each one of these decisions?
Whenever you want to.
Now.
Yes, sir. That would be, I don't know, is Helen going to discuss that?
I think Helen's going to be part of that.
So with each one of these options, I would like to at least have some sort of estimate.
Yes, sir.
That tells me what's like, for example, in this option 1, what is the weekly cost right now, as best you can tell, of extending a week or a week of this PDTO time?
So as Helen comes up, I want to make sure that the court fully understands where we are right now. And don't worry about essential functions versus non-essential functions right now. We have basically 3 categories of employees. We have those that are at their workplace and they're performing their tasks. We have a second group that are telecommuting, and we have a telecommuting policy. And then we have a third group that are at home, but they're not performing any tasks at all. In the last 3 weeks, what we've done is address that third group only, because the first 2 groups are drawing their regular salary, and they're not getting anything additional except for that first group that are working in place, and they are non-exempt. That's the group that gets the hazardous pay. And you're looking at jailers, you're looking at law enforcement, those type of individuals that are non-exempt rather than exempt. So I want to make sure that we all understand that as we expand, if we make a decision to expand the timeline on this, that we're really focusing on what are we going to do with that third category, because the first 2 categories are simply drawing their pay either by working in place or telecommuting, and the ones that are working in place, those non-exempt, are drawing the 6 hours, and then for any overtime, it's 9 hours.
$6.
What did I say?
Hours.
GK.
I'm sorry.
GK.
Yes, sir.
GK. Is it a correct statement that the only delta in cost between what we are doing now and our ordinary operations is the hazardous duty pay that we're paying to those who are working and non-exempt?
It's the hazardous duty pay plus what we've done in the past for that third group, that we are giving them time. And we did it first for 2 weeks, and then we did it last week for 1 week. That way, those individuals do not have to use any of their personal leave, nor do they have to dip into any of the buckets that the judge was talking about. That being the 2 weeks that's covered by the the Fed statutes plus the emergency family leave. Helen.
According to your data, at this point, when you conclude that we have a substantial number of people who are not working, who are getting PDTO, we're plus hazard pay at the end of this pay period, at end of this week.
So the numbers that we were able to draw from the departments, we show that we have people that fall in that third category of 538 employees. Now, that doesn't mean that they all get the hazard pay. It's only the non-exempt that get the hazard pay. And
wait a minute. The third group I thought you said was the ones that are at home not working.
That's correct. And that number...
Well, if they're at home not working, they're not getting hazard pay. Did I miss something here?
So let me restate it. I might have misstated, Judge. Commissioner Fickus asked how many people are basically staying at home and not working, and that's the 538.
Okay.
And the ones that are getting hazard pay are not part of that 538, but those non-exempt individuals who are working at their place of work. In other words, not telecommuting.
Do we know approximately how many there are of those folks?
No, we do not.
So I guess I don't understand how people are filling out hazard pay hours and we can't figure out.
The hazard pay was only made available yesterday at noon, so they may have entered their time to this point, and then we can run the reports to get this information. But at the time we were completing this data, the hazard pay was not available to the employees to use.
It simply took all of the departments and IT SAP group a few days longer than we anticipated to actually get the hazard pay configured and available and pushed out to the employees. And as Helen said, that was really not made available until yesterday. So people were not actually charging hazard pay because that category was not available to them previously, which severely limits our ability to know how many people are going to be charging hazard pay.
And I just have to state that it is unbelievable to me that we've been doing this for 3 weeks and we can't get an idea of who's working at the office.
So the PDTO was made...
Wait a minute.
Okay.
PDTO doesn't have anything to do with this. It's the people who are working on an hourly basis at the office.
That's correct, sir. And PDTO tells us how many people are at home. And that was made available at the end of last week, and we had these numbers together prior to that. So we can look at the people who have entered in PDTO, which we have a number at, as of last week, at the end of the week, $1,638,225 dollars that they've spent on PDTO. But that is not clarification that everyone has entered PDTO at that time.
Do we know how many hourly employees we have?
Yes, we do.
Do we know, and we know that 538 people are at home?
I know that now.
That's what we were able to glean off of the charts that we sent.
Let's just do it right here real quick. And if we know how many hourly employees we've got and we subtract 538 and we multiply that times $6 an hour.
Judge, we don't know if the 538ers are all hourly workers. They could be exempt employees also.
We did run a very rough estimate out of payroll of what we anticipate hazard pay might be at just the flat $6, not any of the 9.
Overtime.
And it's about $1.2 million. Let's just go ahead
See,
and.
right there, that's all we needed.
Okay, but it's a very rough estimate.
That's on this sheet, yes.
It's on the sheet.
It's on the
You were
sheet.
trying to get to.
Yes, sir. Yes, ma'am.
I guess my question is the $3,929,178.72. Is that a rough number?
I'm not sure which, I'm
He's
sorry.
looking at this page, Helen.
Oh, okay.
That's not a rough number for some of the categories. The PDTO is, we can actually go out and calculate the 2 weeks at the top. We know what people charge for the 2 weeks.
That's an actual number.
But the next number is a projection, as it says, because it's an estimate for the additional 3rd week that may not have been closed at the time these were being calculated.
Correct.
So
And
it
it's
is
just-
an estimate.
And it states they're projected.
And the hazard pay is also an estimate.
Okay, Gary, Commissioner Figgis, what are you referencing?
I'm sorry?
What document are you referencing?
It's
this
page
is on
3 of one of your handouts.
Page 3 of,
It says employees non-essential work.
on
at
decision,
chart
the
3.
decision.
Oh,
No, it's not the decision handout.
Chart 5, page 3 of the handout that begins COVID-19 items for Commissioner Court consideration today.
got it. Thank you.
So ballpark estimate for 1 week of
PDTO.
TO time, we're talking about somewhere around 1.2
That's
million
2
dollars.
weeks.
That's it, correct.
2 week period.
For the PDTO for 2 weeks is, on your sheet, is the 1.6.
That's 1.6, and that's actual. That's a real number.
And then you still
Because
got
we
to
were-
add 2 weeks of hazard time?
The hazard pay is down, that's 3 weeks, because at this
Right.
point, you had approved 3 weeks
So
of
you
hazard pay.
take 900,000 off of that number, and that gets added to the 1.6 million for 2 weeks.
For 2 weeks, yes.
You take the 1.471 million and take 67% of it, and that goes up, that's a cost, correct? It's in your total. Okay, let's start over. You said 1.638225.41 is for 2 weeks.
For PDTO, yes.
Okay. Also, for 3 weeks, you've got $1,471,000
Estimated, yes, sir.
for 3 weeks.
Yes, sir.
So you take 2/3 of that,
Oh, okay.
which is roughly $970,000.
Approximately. It is, again,
So you add that 970 to the 1.6, which takes you up to about a little over 2.5 million. That's the cost for 2 weeks.
That's our best estimate of the cost for 2 weeks for those 2 pay types. Yes, sir.
Okay. So, and 3.9 is for 3 weeks.
For both pay types.
for
yes,
both
sir.
pay types.
right.
Yes, sir.
Okay. And we're deciding whether we want to continue this. Is that correct? GK? That's correct? We're deciding if we want to continue this
Right.
practice?
That's correct.
So
Okay.
the first
But
decision, the
there's-
first decision has to do with the PDTO, and that's costing us about $819,000 per week.
Remember, those people would be being paid either way, so that's not in addition to budgeted amount. So those people that are getting PDTO,
That goes back to the question that I asked earlier. What is the delta in cost over our normal operations? We would have been paying these people anyway. Were they working?
The
So what is
delta,
the
the delta for that, sir, would be whatever benefits that they would have had to use had you not granted PDTO. And we don't know today whether that would have been family medical leave, whether that would have been sick leave, whether that would have been vacation leave. And ultimately, their total amount of benefits available for payout at the time of termination may be larger because they were not asked to use any of their own personal leave. But had you not given them the PDTO, they would have possibly qualified for one of the other family medical or first family. And so you might have still paid it, but paid it through those programs.
Let me give you
The
another
hazard
example.
pay is another delta.
Yes, but just talking about the PDTO first, there is no real delta for it because, as she said, we would have paid those employees either for leave time or time if we allowed them to work. So the budget includes 100% of
And
the salary.
that's the answer.
I don't know that well, hold on. Let me pose an example of what I think could be the answer. We gave them 2 weeks. We paid them the PDTO. We get to the end of the year. They've taken no vacation and they decide to leave. Then they're going to get paid. They're going to get paid their regular salary, and they're going to get 2 weeks additional pay because they've got a 2-week bucket of time. So yes, it does cost us, and it will cost us to the tune, in that particular situation, $1.6 million.
And that's what I said, sir. I'm saying that if the employee in your scenario, if that occurred, they would have additional leave that they would be entitled to upon termination. That is correct. Obviously, all of the employees, however many they are, that are actually on PDTO are all in likelihood not going to leave at the end of the year, so it wouldn't all be paid out. And all I was saying also is they may qualify for some other leave category, so they might have still not worked their actual hours or taken their other leave if they'd qualified under the First Family Medical Leave Act.
But again, whether they take, as long as they don't get to the point to where they are losing vacation time, or they have then when they retire, whether it be this year, whether it be 10 years from now, whatever it may be, that 2 weeks will always be there.
Yes, sir, that is correct.
So it's not like it's not costing us anything over the period of time. And the longer we do the PDF, that just adds to that time that is accumulated.
You ready for me again?
I hope.
Okay, so back to our decision number 1. Again, as we said, that would be for you to extend the PDTO for a defined period of time or to end it effective April 15th, so it would be paid through today. Of course, if it ends, then employees will have the ability that those employees, yes, sir.
Maybe you didn't finish.
I didn't, that's okay.
You said earlier that if we ended it, you would prefer it in Friday, correct?
That would give departments a little bit of wiggle room to figure out what they're going to do with their people that have been at home. If they have work they could send home to them, if they're going to bring them back into the workplace, how they're going to manage that, as opposed to, in our department, we've been working on that already and have some plans in place, but larger departments might have more challenges with that, and every department's going to be unique. I know Ms. Tidwell last week spoke about just the physicality of her department and their coziness. Yes.
And by going through Friday, that's about another $500,000. But again, that's.
And you may not want to do that. It just was an option to you. As I said, it would be for a defined period of time. That could be today. You end it as an option 2, or you could do a defined period of time for an extra day or so. So if you do end it effective today or sometime this week, know that the employees then would be able to invoke the emergency paid sick leave and the emergency family medical leave should they qualify, and we'll talk about that. Of course, also employees that might be called back into the workplace that for some reason don't qualify for one of those and don't want to be in the workplace could request leave time, and they would have to receive approval from their appointing authority.
Judge, I recognize that we can't afford to do PDTO indefinitely, but I would sure feel better about ending it if we had masks and gloves for all of our employees.
Commissioner, I think we have masks and gloves for a number of folks. Most of our employees could use bandanas or make their own masks, because if we wear a mask, basically by me wearing a mask, I'm protecting the person I'm talking with from me, not necessarily vice versa. So yes, the masks are important, but everybody could make their own mask or they can wear a bandana, and that's something that public health has indicated.
Well, not to micromanage what people wear, but not everyone has the option of wearing a bandana. So I just want to make that point.
Well, they can make a mask.
They can. I'm just saying. You said also a bandana, and not everyone can wear a bandana.
Protection of our employees ought to be primary.
So I have a question, and perhaps looking for some answers. So if I have the majority of my team at my precinct garage, initially was deemed non-essential, right, based off of where we were at that time 3 weeks ago. But I need to bring them back. We have a job that we need to complete. But then how do they get to the job site safely, which I think that was a concern that Commissioner Fickus brought up last week.
I can give you an answer.
Okay. Groovy.
Couple things.
Okay.
This is what we're looking at, and we're hoping to start back Monday because we have a project that it's a great time to do it because the traffic volume is down. But that's a different story. They could take their own vehicles to the job site.
They can.
They can.
Okay.
Okay. You're going to have somebody drive the county vehicles to the job site.
Sure.
The equipment, the trucks. And that could be one person. TxDOT's rule is if you have two people, they both have to have a mask on. Preferably, they would prefer one per vehicle, but if two, they both have to have a mask on. So, talking about gloves, Richard Schiller, my road superintendent, and I have had a lot of discussion. He's former TxDOT, like many of our supervisors in that department, those departments. He says that the gloves that are available, the blue ones that Helen has, the new ones that are black, says typically those gloves will be shredded in a matter of 30 minutes because their workers are going to have to wear their regular gloves also. And those gloves are going to shred these gloves. So that's what TxDOT is just using cotton gloves, which can be washed and dried, and mask. And if you're with another employee, but typically your employees out on your road crews are generally further than 6 feet apart.
Right.
They're quite often on a vehicle or on a piece of equipment. So that's kind of the practices that we're going to start off using, and when we start back.
Okay. Well, so then we don't have a formal policy about folks driving to a work site, right? So there's not any amendment to policy
if the ride, it's my understanding, if the drive from their home to the work site exceeds the drive from their home to the shop, they would get mileage for that extra. Is that correct? I'm waiting to hear something.
We have a mileage policy that we have been reviewing because it became apparent that there were instances where it was not clear. Prior to the COVID-19 situation, we were proposing bringing that policy back to court for some clarification and revisions, which did not occur because we were not meeting, obviously, even for 2 weeks. It is My understanding from lengthy discussion with IRS officials that commuting is always removed. It's never allowed. And that would be the easiest policy for us to administer. And then, as Commissioner Fickus said, if the job site happened to be further than your commute, then you might be eligible to take those additional miles. But there is some clarification and examples that we were proposing bringing those back. That just hasn't happened.
Okay,
Logistically, workers driving their own cars to a job site create some issues. You've got a lot more cars at the job site parked at the side of the road. That creates some issues with how you get work done. It may also create some additional liability to the county because we have required those workers to drive their own cars to a job site. I'd like to hear somebody from the DA's office speak to that issue.
Commissioner Brooks, this is not something that we have looked at. This is the first time that we're hearing about it. I do. So we would need a bit of time to address the specific questions and points that have been made.
Well, how are we supposed to make a decision today while y'all are researching?
Well, are you asking about, we are prepared to answer questions relating to the Family Leave Act. The mileage that you're discussing is a very intricate, it's a very detail-oriented analysis that we are just not equipped to answer at this point.
My question was not about the mileage. It was about the liability issues.
The risk of the employees' cars being parked at the side of the road, specifically risk, not mileage.
Okay. Could you restate the question, Commissioner Brooks?
Yes, ma'am, I will certainly try. Requiring employees to drive their personal vehicles to a job site where there is no place to park those vehicles except on the side of the road on which you are working causes some logistical problems in terms of accomplishing that work, and it will possibly create some liability issues for the county because we have required those employees to use their personal vehicles to drive to a job site. Would you comment on that?
I would agree that under that scenario, there is an increased liability risk. The specifics of that would depend on how many employees we're talking about. And I mean, it's just, it would certainly increase the liability risk because they're not using county vehicles. I assume that they could have, we could look at their insurance. Someone could look at their insurance coverage. Yes, Commissioner Fickus.
This couldn't be too difficult. You got almost every city in Tarrant County that has their road crews working today. City of Fort Worth, most of the cities in my area are working today. We have an expert behind you.
I'll turn it over to the expert.
Good morning. So the employees driving their personal vehicles.
Tell them who you are.
I'm Travis Yarborough, risk manager. The employees driving personal vehicles, so it'll be their primary insurance will be the coverage while they're driving, transporting to and from the workplace. However, there are certain instances that we could come in secondary if the situation arises.
Now, who was that just spoke?
Our risk manager.
All right.
I think there's a lot of people that are, a lot of work crews are working on roads. Private contractors, public contractors, public entities. I don't know why we're not. So,
I think because we haven't talked about it yet.
I'm not sure that we have to talk about it.
No, I think that's pretty much left up, I would say, to y'all individually. It is.
Okay, so.
I think I can say I want my guys to go back to work and they can go back to work.
Sure.
You can do the same.
I understand that. So Commissioner Brooks actually asked a question I was getting ready to ask about risk management, so I appreciate that input. In this situation, is this just unique to us, or are there any other employees in the county who would perhaps be in a situation to where they needed to drive their own private vehicle to a job site? And I'm just trying to get a feel for how large of an issue is it, or if it's just us, then that's different. I mean, you know.
You're standing again.
Yeah, I'm not sure how many departments transport multiple employees together to job sites. Do you have any?
I don't have those.
No. Okay, so I'm trying to go through my head and think about any departments that would be transporting groups. I'm not coming up with any just off the top of my head. They may exist.
I mean, and maybe there aren't any, but I'm trying to help us move along in making a decision for this first item. I was the one that asked for this information, so I get we may not have, we're not going to know everything, but at least though we can, if it's just us up here that has that issue, then I think that'll help us to move forward with our
Just
decision.
very briefly, we have our survey crew and our striping crew, and they'll be needing to use county vehicles to get to their place of work, wherever that may be. So the goal obviously would be to keep them separated as much as possible.
Sure.
I would think that you could assume that this issue is pretty much confined to the precincts and their operations.
Thank you, GK.
I think that's a true statement.
I don't normally do this, but I'm going to throw a motion out there that says that we end the PDTO time effective at the end of the workday on Friday, which I believe is the end of a work period.
Yes, sir. It's the end of a work week.
Second.
We have a motion and a second. Further discussion? Okay, Judge Whitley votes yes. Commissioner Brooks?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously. Yes. Did I forget you?
Yeah.
I'm sorry. Commissioner Allen?
Yes.
Motion still passes unanimously. Sorry about that. I have a little list up here, and I didn't look at the list.
Sure.
You'd think I'd be able to figure this out. Sorry about that. Next.
Okay, so item number 2 of our 5 decisions, hazard pay. So the hazard pay has been paid to non-exempt employees that physically have been reporting to work. Okay, and we have a couple of different choices. Option 1 would to be continue the $6 an hour effective tomorrow to some end date. Option 2 would be continue at a different rate if you wanted to change the $6 to a different rate. Or option 3 would be to discontinue.
I move that we continue it through close of business Friday.
I second that.
Okay, so let me be sure I understand. $1,471,840 is 3 weeks of what we estimate to be hazard pay.
I gave mine to her.
Yes.
So that's about $500,000 per week right now for folks who are actually working and potentially encountering the public.
What was your figure again? You just said
490,000, and I would say for the most part, most of those are jailers.
Well, I don't know that that's necessarily true. I know, I mean, they're the largest number, and our patrol officers are also non-exempt all the way up to.
And that would be the most?
Well, I'm saying the law enforcement group, yes.
So it's somewhere between $70 and $100,000 a day. If they were all working 5 days a week, then it would be 100. But we've got a few people over in the jail that we can't take off the weekends. So for most of those folks, they're working. I mean, we're probably talking about 70,000 a day.
And those folks have PPE, right?
Well,
do they have masks and gloves and?
They have it. Yes, they have the PPE. Whether or not they're all utilizing it or not is yet to be determined, but that's not something we can suggest it, but look at how many people have masks on out here. Yeah, I saw you just pick that up right quick. So, yeah, I mean, I hear what you're saying, but I do think that still for those folks who are coming in and their essential functions that they might deserve something. Maybe $6 is more than we should, but at least until this thing turns down a little bit. I mean, now it's in the jail. We kept it out of the jail for a long time, maybe for whatever reason that was, but.
Could I point out one thing to make sure that I'm not missing something?
Sure.
So since we have now done away with the PDTO, I have to believe that we're going to have more people who are wishing to return to the workplace. Some of those people will be hourly. So there's the potential that this cost could increase. Some of your road crew workers may be hourly, and you're sending them out on the job.
Right.
So if you continue this, I just point out the cost could actually increase only because you're going to have fewer people that are maybe taking advantage of their ability to stay away from the workplace because we no longer have a PDTO for them.
Good point.
But we're ending it. I mean, the motion's to end it Friday.
I understand.
The motion for the other, what we passed, the other employees come back to work Monday.
So any other discussion regarding this issue? So your proposal is to discontinue it, which is option 3. Discontinue hazard pay effective not the 15th, but the 17th? The end of the workday on the 17th.
The same time as the PTO expire.
Well, I mean, I would like to offer some hazard pay, but I don't have a sense of what we can afford to offer either.
Do we have any indication whatsoever at this time whether or not that would be considered a reimbursable expense under the plan, under the Stimulus CARES Act?
I don't know the answer to that, and the only thing I'd say, the accountant in me can't help but say it, is that for it to be stood up as an appropriate cost, we would have to truly be able to demonstrate that there was a hazard just for the hourly employees and not all other employees, which I'm not advocating you extend it. I'm just pointing out that if I were an accountant preparing documentation for the federal government, I would need to be able to show, certainly when we had people that were not required to come to work, they were being able to stay home, and we were asking people to come. Now that we're saying everyone needs to come to work, or you have to take leave, or you have to telecommute, it would be harder, I think, to justify who was a jailer, maybe not. So I'm not implying that I'm placing judgment on any category. I'm simply saying I think you'd have to address it by category and justify why it was hazardous for that employee to be compensated that amount. Otherwise, again, it's just additional compensation that you could have given at any time. But that's just, I don't have any definitive guidelines other than I know that what we were told is all of the costs associated with the CARES Act have to clearly be associated with the COVID-19 episode and cost associated with taking care of the public health and safety, yada, yada, yada.
Judge, my motion was a simple one, to end the hazard pay at the same time we end the PDTO. If it doesn't get a second, then get another motion.
Already seconded.
Now, we haven't voted yet, but
We were discussing.
I guess my only, again, Renee, based upon what you just said, you know, I kind of would like to see it maybe continued at least for the jailers that are in the jails with our prisoners, our guests. And maybe it could be a reduced amount, but
and again, cost-wise, if it's overtime, which the jail does have a lot of overtime, it's actually $9 an hour, not $6. But so any of the numbers you're looking at do not include the additional $3 because we don't have a true estimate at all of the amount of overtime that's been worked.
But if we left it at 6 and we were just looking at jailers, we would be less than certainly less than the $500,000 that we were talking about otherwise.
And I would suggest if you do it just for jailers, you need to include juvenile detention also.
I would agree with that.
Confinement areas.
Confinement, any confinement type folks. Okay, we've got a motion and a second. I don't hear the motion or the second being willing to make any adjustments at this time. So we will vote. Judge votes no.
Repeat the motion.
The motion right now is to end the hazard pay effective at the same time as the end of the PDTO time, which would be the end of the day this Friday. And now, how are you going to, however y'all split the jail shifts, because that's going to be over a period of time. So whatever you do there, you do there. So, Judge votes no. Commissioner Brooks?
Yes.
Commissioner Allen?
No.
Commissioner Fickus?
No.
Commissioner Johnson?
No.
Okay, so let's try another motion.
In hazard pay, I'll move that we end hazard pay on Friday, April 17th at the end of the day, except we continue a $3 an hour hazard pay for jailers,
confinement officer.
Confinement officer. And that would include juvenile.
Technically, it should say confinement employees, so let's not call them officers.
Okay.
Now, does confinement, and that would,
confinement employees.
Now, does that get all the hourly folks that we need to?
That would include booking, correct?
Come on down. Smile, because you're going to be on the camera.
Any of our confinement officers, that would include 50 grade, pay grade 51s, 52s, and some 53s that work in the jail. So those would be the 3 pay grades that are in there. There's also clerical staff, clerks that work inside the jail with that. So how you split that?
That's why I suggested we call them confinement employees and simply have the net cast on anyone who was behind the locked door. I mean, including your civilians.
Yeah, and a large number of the civilians work on the non-secure side of the jail, but they're still within the brick and mortar of the jail.
So you have to clarify for me, who's included.
Okay, so it's confinement employees, confinement employees.
Yes, sir.
Okay. Did we get a second?
Well, I got Jack up there, and I don't think he's standing because he got tired of sitting.
Did you say did you add warrants? I'm sorry.
No, we just did confinement.
Confinement only, both for juvenile and adult.
Yes.
Given the authority to deem our employees essential or non-essential, I felt for 25 years that our people are essential. We're supporting the people on the front line, the front responders, ME's office, public health department, and those other essential employees. I have 5 hourly employees who worked every day. And I really don't understand now that we're telling them they've been here every day. Today, or after today, that they're not essential. It seems a little shallow, and I respect the tough decisions that we have to make, but I would almost suggest that we allow hourly non-exempt employees who are essential to be paid that stipend, that hazardous pay. Thank you.
My deal went off.
Okay, just a second. Wendy?
Yes, sir. Wendy Burgess with the tax office. I can share with you for the last period for my department, we had 51 various hourly employees work, a total of 938.25 hours at $6 an hour, which is $5,629.50. These are the people that are collecting the taxes and answering the questions of taxpayers that are out clamoring for answers and asking for waivers, things like that. We're answering those phones every day. We are running the payments through our retail processing center that has run continuously to make sure that this county has money to spend to fund all of these payrolls. So I have kept it, and I know Renee has kept her group as small as possible in the spirit of the ordinance and the request that the court has made to keep our social distancing, to keep our employees safe, as well as to keep our constituents safe that come in and do business with us. But the employees that I have had come in, they are essential. Many of my folks are hourly. They are not detention officers, but they are doing an essential service for the community, for the county. And if we need to stop collecting money, we can stop collecting money. I don't think that is your intent, by all means. That's why I wanted to share with you the exact amount that my office has created by that hazard pay. So a mere $5,629.50 of the total for that last period. And these folks are performing essential services for our citizens, and we are answering thousands of phone calls. We have 3,400 registrations that came in just yesterday, and 2,300 titles to be worked as well in our motor vehicles. So not only property tax, but motor vehicle. We are trying to keep our independent dealers as well as our large dealerships in business. We're trying to keep businesses going in Tarrant County, whoever can be open. So that's what my folks are doing to honor the requests of the court. We cannot fully staff and be socially distanced properly. We've tried in all of our branches, and we simply cannot do that. But I am here fighting for the folks that decided to come in even on a holiday and work on a holiday, because the citizens were giving us, were calling us, asking for answers, demanding that we do things, and we had conversations with them.
there are multiple conversations
sorry.
going on, and I know y'all are probably trying to gather data. It's just hard to hear the speaker, so.
That's all I have. I just wanted to share with you the good work of the people that work within my department that I am so proud of, and they stood up and they said, call me in. I will come in and I will work. And Judge Whitley, you know, some of my folks have worked in your office as well, because we are Team Tarrant County. We are Tarrant County strong. But my folks are Tarrant County strong, and I believe just because they're not a detention officer doesn't mean they shouldn't receive compensation as well.
So if we could,
Helen, do you have some just
we
earth-shattering information that you want to?
hazardous pay is considered is a compensational item under FEMA, and so you asked the question: is this something we could probably get covered by the CARE Act? That's the answer. To that's probably 98% of that me says yes. We'll be able to do that.
So with that, I mean,
So the question.
I may end up amending my motion to basically say that.
I think I made that. The motion was.
Well, just go right ahead. Now let me, because one of the things I had looked at.
My question is, when we were talking about everybody losing, nobody said a word. And then when we decide to give something to somebody, then everybody jumps up, well, me too, me too.
And without, I mean, the one thing I'll say is I think we are talking about a relatively small sum of money. But the one difference is the jailers are working in a confined area where they're not, you got 48 into a pod sometimes with one officer walking around amongst them, as opposed to people coming up. What are you looking at me like that?
I'm just listening.
Well, your face wasn't just listening.
I just want to say on the record, I disagree. I mean, if you're going to pay hazarded pay, it goes really on behalf of the constables that are out there, and behalf of the SO patrol, the people that are coming in front of people that have families and all the situations. We can argue the other side of that coin. They're confined. They're in confinement with 48 people that haven't been anywhere. So to me, for the record, if you're going to do this, it goes to everybody, not just my staff, but really for the people that are out on the streets, your constables and everybody. So I say all or really none. I mean, because the cases are increasing, Court. They're increasing. You paid $6 when we had 10 cases. Now they have doubled, and now you're saying, let's not do this. So if we're going to not do it, then for the record, look at everybody.
I think we're to the point where if we
eliminating PDTO, we're asking county employees to come in and do their jobs. So I wouldn't give anybody hazard pay.
You tried that, it didn't work. So we're now trying to hit a compromise.
Yeah, but it should have.
As I was taught from the beginning, it takes three to tango. Commissioner Fickus, since you made the motion, do you wish to open it up to everyone that is currently, or that will be, I guess, as we bring the thing back open and other people come back to work, if we continue this, then it will be under your motion, $3 an hour. Right now, it's just a confinement. Do you wish to open that up to everyone who is at work on an hourly basis?
No.
Okay. Who seconded? Did I second that, or did you second it? Who seconded it?
Well, we were. Nobody seconded it. We need another motion. See, you can make a motion.
Okay, and I'm going to make a motion.
If not, I will. So,
do you go ahead and try?
Okay. Well, so then I'd like to make a motion that we continue hazard pay instead of at $6 at $3 for everyone, for all non-exempt employees.
Until when?
what's a reasonable amount of time for us to
Next week.
to have some numbers?
You have a shelter in place order until April 30th.
Okay.
Again, but I just need a date from a payroll perspective.
Sure. Well, I'm trying to answer your question. So, what?
Would you consider maybe next Friday?
Why next Friday? I'm not saying that I wouldn't, but just
or at least do it to the end of a pay period. So
that's what I'm getting at.
And that wouldn't be next Friday. That would be Friday the.
Any Friday works.
Friday
It's the
is
end of a pay period, a pay week.
Okay.
So this next Friday is the 17th. The following one would be the 24th. The following one would be the 1st.
I would say extend it at $3 till the 24th. That's my motion. Yes.
That's correct. So you
Because
have,
that's the only employee group that's eligible for it right now, right?
so Judge, you have a motion now.
I have a motion.
Could you restate the motion?
Yes. My motion, I'm going to restate my motion. So my motion is that we continue hazard pay at $3 until Friday, April 24th.
For the exact same group that we currently have.
That's right.
Non-exempt.
That's right.
Non-exempt.
For non-exempt.
Second. Any further discussion?
Is that for all hourly employees?
Yes.
Yes.
Yes, motion passes unanimously.
Wait. Couldn't pass unanimously because I vote against it.
Judge Whitley votes yes. Commissioner Brooks?
No.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes 4-1. Next, Robin? Hi, Tom.
I just have one quick question.
As long as it's a question.
Well, it is a question. Currently, we've got about half the staff at home. We have half of them working, roughly 52% is what it is. We have another smaller group that is ill or has, previously approved medical leave, let's call them. So they don't count. They're drawn from their benefit bucket. So what you just did was basically cut the hazard pay from 6 to 3. So those people I have at work would be making 3 starting when?
Monday.
This coming Monday.
No.
No.
That's what I'm asking.
Well, then I think we're going to have to go back and readdress that because we have.
The $6 currently ends today.
I believe that we said the $6 would currently end. I thought this was going in lockstep with the PD, whatever that word is, and that everything would be effective this Friday. That's when that would stop.
No, that was my motion that y'all voted against.
Because the current motion that you passed for the $3 couldn't start until the previous one expired, and you didn't effectively extend the previous one. So if you want it to go through Friday, the $6, you have to make a motion that actually extends it, because otherwise it ends today per the motion you passed last week.
You're the one who made this motion.
I know, but you're the one with the question.
Well, okay, so
I was fine with what
you're fine with where we are. That'll create a little bit more havoc with payroll, so I'm probably okay with that.
Well, that was not my intention. That's not what I intended.
That's what I didn't think you intended.
Okay, so to clarify, do I now need to go back?
Yeah, we're going to have to reconsider the motion.
Okay.
And then we're going, if I'm right, I think we first have to reconsider the motion. And then once we've reconsidered it and brought it back up for discussion, then you're going to amend, I believe, the effective date. 2 things. 1, you're going to extend the $6 hazard pay through the end of the payroll, Friday, the 17th. And then effective for the next week, you'll go at $3 an hour.
I can do that.
Need to vote to reconsider.
Fair, I understand that. We're going. I never liked Robert's Rules of Order. I knew it was
Y'all are pitiful.
But since the four of us voted for it, all it takes is you can vote to move to reconsider, please.
I'd like to make a motion that we vote to reconsider
This motion that we made.
the motion that we made regarding hazard pay.
Would you like?
I agree with this. I'll continue my
Second.
second.
Let's vote. The judge votes yes. Commissioner Brooks?
On the motion to reconsider,
Yes, sir.
yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
I can tell you're happy. You ought to be here. Now, Commissioner Allen.
So I'd like to make a motion that we extend the current $6 hazard pay to Friday, April 17th, and then continue with the hazard pay at $3 starting on Saturday, April 18th to Friday, April 24th.
I second.
Any discussion? The judge votes yes. Commissioner Brooks?
Votes no.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Thank you, Tom.
And to finish, because it was contingent upon what you
Motion
voted.
passes 4-1.
So you answered that part of it. So then the people that I have at home are still straight time, or do I need to call them back to work so they can get paid?
Well, they're straight time through Friday, and then you're probably going to have their own PDTODAI.
Okay, that's where I lost y'all, was on that bucket.
Are they telecommuting?
No.
No.
If
One
they're
of them
on
is.
PDTO, they passed a motion, if I have it correct, that they can continue to charge that PDTO through Friday, the 17th.
Okay.
The 18th or after, they're on their own.
If they're at home,
If they're at home,
they ain't getting paid.
unless they charge a leave or qualify for some sort of family medical leave.
Gotcha.
Or you to deem them essential and call them back to work. Because I would think under the local order, anyone that's called back to work still has to quote unquote be essential.
They're also qualified for this emergency pay, if they qualify.
And when I say family medical, I mean both of those, yes.
Well, that's what we're gonna do then, is call them back to work so they don't lose their salary.
Okay, so now to decision item number 3. Under the emergency paid sick leave and the emergency family medical leave, it allows for exclusions. Okay, so it allows us to exclude certain employees from invoking either of those acts. Those individuals, it's quite a lengthy list, are those healthcare providers, emergency responders, that employees who are necessary for provisions of transport, care, health care, comfort, and nutrition of such patients, or whose services are otherwise needed to limit the spread of COVID-19. This includes, but is not limited to, military or National Guard, law enforcement, correctional, institutional personnel, firefighters.
So you're asking if these individuals should be exempt from participating in this? Is that what you're asking?
Well, I need to so there's a large group of them, but they also say can be persons with skills needed to provide aid in declared emergency. So you have several options. Option 1 is to have no exclusion, so all employees would be eligible. Now, the pros and cons of that is that we allow all employees to have access to that. The difficulty of that could be that in some areas of our workforce, if enough people invoke that one of those acts, it could have a significant impact on staffing.
We'd have nobody to watch the prisoners.
It's possible. Okay, now option 2 is that we would have exclusions and we would continue under the practice that the appointing authority designates who are essential with HRs in conjunction with discussion. So just like now, we've allowed the appointing authorities to determine who is essential and that they would still be able to do that.
So if you had an employee providing an essential function and that person could be, if they're an emergency responder, is emergency responder the same as an employee doing an essential function?
It could be.
Like maybe a mechanic.
Yeah, well, that would probably also be a person with skills needed to provide certain services. So, for example, I actually was on a webinar the other day by the Texas Association of Counties, and they talked about, so we're still in storm season here in our area. What if a road washes out? Well, then and it's in an unincorporated area, then your road crews absolutely become essential. And so there may be times where, individuals that you wouldn't immediately think of, like at a jailer or a healthcare worker, would be deemed essential. And of course, we've, like I said, previously under the who is essential right now, we've allowed our appointing authorities, our elected officials, and department heads.
So back to my question.
But yes, that's true, it could be.
So if the appointing authority said this person, this mechanic is essential or an emergency, then basically they can say they cannot exercise the leave in the expanded FML unless, let me guess, it's the items for childcare.
No, actually, it's all of it. Now, one of the things that a department could do is agree to intermittent use of the emergency paid sick leave or the family medical leave. So maybe if there's 2 mechanics or different people, you could rotate them in and out or work different shifts. There are a variety of ways that departments could address this, even if those individuals might be deemed, and somebody stop me if I'm lying. Okay.
Okay. So that means that each appointing authority can determine the employee's status as to whether or not they are going to qualify under 1 through 6.
And the family medical leave, the child care, yes, and that would be option 2 of this decision point.
Just for the sake of getting home before 7 tonight, I'll move option 2.
Second.
We have a motion and a second for appointing authority getting to make the decision as to who is deemed to be performing essential functions.
In conjunction with HR, so.
In conjunction with HR. We have a motion and a second. Any discussion? All those, okay, Judge Whitley votes yes. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Motion passes unanimously.
Now we get to the more difficult ones. Decision matter number 4. This has to do with the compensation for the 2 different acts, okay, under emergency paid sick leave and the emergency family medical leave. There is the ability to have restrictions or have a maximum per day amount that employees could be paid. Okay, under the emergency paid sick leave, if an employee invokes reasons 1 through 3, okay, we could limit the pay to the employee's regular rate of pay up to $511 maximum per day. That $511 maximum per day comes out to about a little over $132,000 annually. So if we set that limit and somebody used one of those reasons, if they made more than 132, we could cap that. Option 2 would be that we go ahead and pay them at their regular rate of pay, and remember the regular rate of pay includes some of those other pay types, and we would have no limits. Obviously, this could, one point to make is if we apply for tax credits, if we are going to be eligible for tax credits, they will only give us credit for that $511 per day maximum. So if we decide to pay above that or with no maximum, the credit would be limited.
Okay.
So
Can I, if all of a sudden brain just kind of engaged, and I'm seeing Sharon Clark sitting over in the corner, who's been sitting over there since 10 o'clock this morning waiting for one little vote.
She's right after we finish this.
Well, I understand that, but that was right after we finished it beginning at 11. So, I mean,
I'll step back.
because I think we've got another, hopefully this will make this next two real short, but Sharon, come on down.
I never know with y'all.
I never know with me. I mean, I apologize to Sharon for her
So
getting to sit through this ordeal.
This is item number 4 under the administrator section. What we're requesting, or the hospital district is requesting, and their board has approved it yesterday or last Thursday. They would like to begin working on the possibility of issuing certificates of obligation of no more than $75 million. This would be, they refer to it as a line of liquidity. They can negotiate the terms and everything, but they would still have to bring this back to Commissioners Court for final approval. The utilization of this line of liquidity or certificates of obligation is to fund capital projects that they have budgeted money for, but if they run out of money because of COVID, then they would be able to use the COs to pay for that capital, and it would free up an additional $75 million for the hospital district to use to operate. Is that correct?
I move approval.
Second.
I have a question. What's the difference between, what did you call it?
The line of liquidity versus
Line of
the
liquidity,
certificate of
a
obligation.
letter of credit, or a CO?
If you look in our analysis, and they're talking with J.P. Morgan, J.P. Morgan refers to this as a certificate of obligation. And that's what this is, because it would fund only capital. I mean, you can do that with certificates of obligation. And it would just provide additional $75 million worth of liquidity if, in fact, they need to get to that point.
Is there a reason it's not initially called a CO?
If you look on the agenda,
That's all.
it's entitled certificates of obligation.
Yeah. Kinda.
So my question is, what, if any implications does this have for our larger bond measure?
Speaking for myself and not for our board of managers, I believe that this would create a delay until we can see what the financial impacts are going to be for the COVID pandemic.
Well, okay, now wait a minute. This just issuing of this CO would not.
It does not. No, I thought her question was more general in nature. So let me speak to the CO as it was presented to my board. We're obtaining this liquidity instrument just mainly as an insurance policy. We have almost $700 million of cash. We would access that first. We have about $140 million earmarked for our capital projects. And then this would be last resort. We, at the moment, do not have a need for this. However, given the current environment, liquidity lines are quickly shrinking and they're becoming much more expensive. So this is our effort to make sure that the district will stay operational if the pandemic is extended for a long period of time.
Do you see this as, well, I kind of look at this as a backstop, which is not necessarily always a positive. So do you see this having any effect on our bond rating through S&P and?
The execution, if we were to borrow against this May, but the execution of the line of credit, it's only for 364 days. If we were to draw down on it, it would be considered as part of our debt, but would not necessarily prohibit in itself us obtaining the larger bond issue.
But if we draw down on it, we're going to be in a whole lot worse shape than.
Correct, and that was the first question that I was actually answering for Commissioner Allen. Given, if we were to completely deplete the cash and required to access this line of credit, the assumption that I would have as the CFO of our organization is that those plans would be postponed until we could financially recover from the impacts of COVID. Again, today, I don't see that as an issue. It really just depends on our extended recovery.
Sure, which of course, then there's only so much of that.
Are you saying that in that $748 million in cash that would be your first spend, is that the money that's set aside in the futures fund to support the bond issue?
Yes, that is part of, that's the $140 million that I referred to, Commissioner Brooks. That would be the secondary pool of funds that we would have to access.
So, but what you're asking here is to just proceed through the process. You're still going to have to come back to the court for approval and to issue these. And so you could issue these at any time. You could issue it before you spend any of your cash, or you could issue it after you spend all of your cash. But I think the key to this is that you're saying that the ability to go out and secure $75 million may be limited because of the economic environment that we're in. This is a backstop of $75 million if you need it in the future.
That's correct.
Is there a fee required for you to do this?
Yes.
And how much is that fee?
The fee, the upfront is 10 basis points, which would be about $75,000. There's also an unused fee of 50 basis points or 0.5%. That would be $375,000.
That's if you execute the CO?
That is.
Or is that just to get this letter of
Correct. So the $75,000 is upon execution. If I don't draw down at all at the end of the 364 days, it would still cost an additional $375,000.
What if you did draw down?
If I draw down, it's set at 80% of LIBOR plus 1.5%.
For what you draw down?
For what I draw down.
So
I
let's
would
say
either
you
be
draw
at
it
the
down for a
2.3.
day. Draw it down for a day and then you pay it off. That's going to be less than $375,000, isn't it?
No, the unused fee is $375,000.
Well, we use it all. We borrowed every bit of it.
That would be at today's rate at about 2.3%.
That's a lot of money.
It is a lot of money. It's a large credit facility.
When you're sitting on the kind of cash you're sitting on. I don't understand it.
So again, I'm sorry, Commissioner Brooks.
One day on $75 million at 2% is $4,109. So if we borrowed all $75 million today, paid it back tomorrow, it would cost us $4,109.
Correct, for that one day. And then for the other 363 days, I would pay 50 basis points on an unused fee.
So it's not, you've got to borrow it for a full 364 days.
No, you either get the 50 basis point charge if it's unused, or the 2.3% for the portion that is drawn down. So your maximum charge would be 2.3% under today's rates.
But how long does it have to go before you pay it off?
I believe that you can pay it back at any time.
So I borrow it today. I pay it back tomorrow. As a result of that, I have used every bit of it. I have paid it back. Are you saying there's still going to be a charge for the unused days if I don't hold on to it for?
Correct.
So every day I
It's a
don't
daily
use it,
rate.
I get to pay a lot.
It's $375,000 for the 364 days, so.
That's crazy.
$1,000 a day. Have it sitting there, ready for you. Okay. Do we have a motion?
We do have a motion and a second.
Oh.
So, is any other questions?
Why is the money that we have set aside to support the bond issue even on the table?
At this point in time, it is the only earmarked dollars that we have. So we don't include that as unrestricted cash. It is board restricted. But in the event of us having to access some liquidity, that would have to be the conversation. Do we spend the $140 million that we have cash in the bank, or would we pursue a portion of the CO?
And the board voted unanimously for this?
They did.
Okay, if there's no other discussion, Commissioner Brooks?
Jesus.
He's not here to vote.
This is a horrible deal.
Yeah. You've been voting first, Judge.
I don't think, what other options did the board consider?
The way that we got to this one proposal is through consultation with Hilltop, who are our financial advisors that help us with any debt issuance, as well as co-counsels at Fulbright and Kelly Hart and Hallman. So based on our options, this was the best long-term solution for just the liquidity instrument that we were looking for. We considered about 3, but based on the discussions of that group and consultation, this was the highest recommended option that was available to JPS.
So when we talk about this window of opportunity being narrow, and with each passing day, obviously the change in the financial outlook would change because of many factors, but are we talking about if this were to be presented to us again, it may be at a different rate, which could cost more money, or what?
If JP Morgan could extend this, which I don't believe that that's an option that I can count on, it would be at a higher rate other than the 50 basis points.
I mean, I get the whole concept of insurance, but this is really, 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 really expensive insurance.
It's a very large line of credit. Yeah.
All right. Holding my nose, I vote yes.
Commissioner Allen?
Feeling like I really don't have any other option. I wish there was some other option, but yes.
Commissioner Fickers?
No.
Commissioner Johnson?
Yeah.
The judge will vote yes reluctantly.
Thank you.
Thank you.
You might want to run.
Thank you, Sharon.
And I'm sorry again for making you stick around here as long as you had to. All such great little decisions we're making.
Okay, so we are back to page 2 of the decisions under compensation. We were discussing under the emergency paid sick leave, if the person invokes reasons 1 through 3, what do we want to pay them? Do we want to utilize the limit set in the Act, which means we pay them the regular rate of pay but limit it to $5.11 a day? Or do we pay the employees at their regular rate of pay with no limit? We had a discussion also, or I mentioned, that should we be eligible for a tax credit, the only thing that we would receive credit would be up to that $5.11 per day. So you have 2 options there on the compensation under the emergency paid sick leave.
So let's talk about the tax credit. I mean, again, so basically if somebody qualifies for 1 through 6.
This is 1 through 3.
Under the requirements.
Okay, 1 through 3.
You want me to? So those are the 1 through 3 is the employee is subject to a federal, state, or local quarantine or isolation order. The employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19, or the employee is experiencing symptoms and is seeking medical conditions. So under reasons 1 through 3, this compensation method is
However, the DA's office is of the opinion that we're a governmental entity, that we're essential, and therefore item 1 doesn't work.
I think they're going to address, well, do you want me to address it? There is a scenario in which number 1 could apply, and that is if we allow intermittent use of the paid sick leave. If someone is, let's say that there are 2 individuals in IT who are both performing the same functions, but they're on a staggered schedule, so they're coming in different days of the week. On the employee who is not performing essential duties on a certain date could be told they don't come to work, and therefore, because that employee is not performing essential duties, then that person could qualify and request leave under number 1. So there is a scenario if you are asked not to come to work because you are not needed to perform essential functions on a certain date, then they would qualify and could ask for paid leave under the Act.
So that wouldn't have to be intermittent, though, correct? It would be if I deemed one of my employees to be non-essential, period. Then they would qualify under the Act because they would be non-essential. Therefore, the local order would apply because they were non-essential.
Well, we are discouraging the labeling of people as non-essential.
The function, if I deem the function to be non-essential, yes.
If you are saying that for 2 weeks that they're not going to perform any essential functions and you ask them not to come to work, then they could apply and qualify. So that is the limited exception. So up to the department heads will decide what essential functions must continue and who must perform those essential functions. To the extent that they can be performed on a skeleton crew or a staggered schedule or whatever, then anyone who's asked not to come in could apply and be paid if they're asked not to come in to perform essential duties.
Or if they qualify for one of these other reasons, they can say they can stay home.
Yes, the answers that I'm giving only apply to seeking qualification under number 1 of the Act.
And under our current deal where we said we were going to give them full pay, there's no incentive for them to come home, come back to work because they're getting paid full-time at home.
Well, when the PDTO goes away, then everything changes, which is why this becomes important now that PDTO is going away.
Well, but they'll still get 80 hours before, plus family medical leave if it's childcare.
If they've used up their 80 hours because they've already been out 2 weeks, there are employees that could have to make this decision when the PDTO goes away. I have employees who've not been at work since this started, so I have employees that have potentially used the 80 hours of PDTO and will be looking at either returning to work, me determining whether their functions are essential or not, or them needing to qualify under the Act starting next week. And I can't believe I'm the only one that will have that.
But they would, in effect, have not been using 80 hours of PDTO, they'd be using 120 hours.
Right, so, but I'm just saying the 120, so yes, they would be looking though at needing to do something next week.
And so if we were to reduce the pay and they decided they wanted to continue to stay off.
They couldn't decide themselves.
But if the appointing authority wanted to allow them, they could either use comp time, bucket time,
No comp time.
bucket time, or they could stay at home for less than what they would make if they came to work.
Correct. If
you choose that option to pay less, my only concern, that I do need to speak up on that option, is it is administratively difficult to administer. I'm not trying to be funny by saying it that way. I don't want to step on the law part of it, but I do want you to know from a practical, technical aspect of payroll, it becomes a little bit more complicated to start calculating 2/3 of their base pay as opposed to just paying them their pay.
Go ahead, Leslie.
We aren't yet talking about the 2/3 pay because we're talking about qualifications 1 through 3. And so you can pay them, you can cap it, like Robin was saying, or you can pay them their regular rate of pay for 1 through 3.
Right. It's the 511, right, Robin?
Yes, 511 is the
okay.
limit on the 1 through 3.
Okay.
And I do want to note that there is something in what HR prepared that discusses how many employees are expected to be affected should you choose to pay them their regular rate of pay. I believe it was 200 or less. So from an administrative standpoint, as Renee was discussing,
It's just a calculation on the 200, if it's only 200 employees, yes, ma'am.
but I'm hearing you correctly saying that if you just pay them straight pay, it's going to be more administratively, it's going to be easier for you to perform from an administrative standpoint?
I'm sorry, I was confused. I thought this was the 2/3 one.
Okay.
Calculating the 2/3 makes it more complicated.
And I'm confused, and I have no idea where I got lost, so.
It's okay. So remember, the regular rate of pay includes not only their base pay, but other pay types. So the other pay types, if I could find the right page, are the different kinds of
Shift differential.
thank you, hazard, field training, and out-of-class pay. So we have to pay them that regular rate of pay. We will have to do that type of calculation. Then the choice is whether you want to put the limit on the $511 per day for those people that might earn more than about $133,000 a year. And
We got hourly employees make $133,000.
this is for anybody. This isn't just hourly employees that are eligible for the paid sick leave, the emergency paid sick leave. All employees are eligible for the emergency paid sick leave under the Act.
Government, I'm here to help you.
Pardon me?
I said I'm from the government and I'm here to help you. Thank you, Congress.
So to your point, your question, well, no. Okay, so.
Yeah, please tell me what my question is, because I sure the hell don't know.
The question that you had that prompted Leslie to come up initially about the DA's office deemed us maybe that's where I got lost. So will you ask that question again?
Yeah, because I can think about it. Wait a minute, I got it. Don't.
Okay.
It was my understanding in conversations that item 1 said, you're under a state of emergency. Well, we're under a state of emergency at the state level, at the national level, at the local level.
Okay.
But because we are a government, we are deemed to be essential business, and therefore that number 1 qualification most of the time doesn't apply.
It does not apply if the employee has been assigned to perform an essential function.
But that's most of the time. So what I said was right.
Yes,
most
sir.
of the time. Okay.
Do you have a recommendation?
Okay.
Recommendation.
Yeah, do you have a recommendation?
Thank you. Obviously, for payroll and for everyone, it's more complicated to put the limit in. I don't think this is as complicated as the limit on the other two, because
it would be simpler to continue just to pay them at their regular rate of pay, because we're already set up to pay them at that regular rate of pay, including those premiums, because those are all attached.
I do understand that. And are all we talking about is about 200 employees with this group, or do we know yet?
I don't know.
You have that in your documentation.
Yeah, I'm trying to.
Well, I have a lot of
Is
stuff
that
in
the
my
one that's the
documentation.
200?
I don't
Okay,
know
I
where it
wasn't
is.
finding it
No,
on
I
my
was
page.
suggesting to Robin it was in there.
Is it a process that takes 10 extra minutes per employee, or does it take
It's
30 extra seconds?
It's the programming in SAP for just 200 people.
Okay.
And I can't speak to what that would look like, but we would somehow have to recalculate the pay for those 200 people, because they're set up in SAP on a today's basis and go forward basis for it to be calculated the way it is. And so we would be altering the way pay was calculated for 200 people, and I don't know what that looks like.
Somewhere in the course of the conversation that I was a part of, it was mentioned that if we're paying full amount, there is no incentive for the employee to decide to come back to work. And that at least if their pay was being maxed at 511, they might have an incentive to want to work, and come back to work.
For those two, as we said, this is a smaller group, but yes. I mean, the second, 4 through 6 is much more impactful the way that calculation impacts.
But if we're going to do the 500, is the 4 through 6 also going to be eventually a 511 number?
No, sir, it's a different kind of calculation.
Wonderful. So the 511 was a day?
Yes, sir.
So 511.
Are you looking for a motion?
I don't know what I'm looking for.
Yes, sir. We
How
are looking
about,
at
let's go with option
132,008.
one. Utilize the
annually.
limits set by the act, and which is option 1. And I know this will be it's going to be an issue for the auditor's office.
Well, it's really an issue for the people in IT and SAP to get it correct. It's not going to be a manual calculation by the auditor's office. It's always going back to configuring and setting up the system to work, and then, yes, making sure it's correct, but it will require IT time as well.
Am I correct in assuming that although 200 employees may be affected by this rule, that not all of that 200 would opt to apply for this coverage?
That
So
is
wouldn't
correct.
actually be affected by it unless they applied for it.
That is correct.
But we would still have to adjust SAP to accommodate a smaller number, maybe not one person, but SAP is not a manual system. We don't calculate payroll manually. We do still have to change the system.
So what was your motion, Commissioner?
My motion was to accept option one, utilize the limits set by them, which would limit it to $511 a day, $63.88 per hour, or $5,110 per pay period.
Is there a second? So there's not a second, so do we have an alternative motion? I guess that would be option two, since
Yes,
option
sir.
one.
Yes, sir.
So do I hear any motions to approve option two?
So moved.
Do I have a second?
Second.
I'll second.
We have motions and seconds. Any further discussion? Commissioner Brooks,
Yes.
Commissioner Allen,
Yes.
Commissioner Fickus,
No.
Commissioner Johnson,
Yes.
Judge Whitley votes yes.
So our next compensation under 4B is if an individual invokes the act for either the emergency paid sick leave or FML, there are also limits described there. So utilizing the limits would mean that the individual would be paid 2/3 of their regular rate of pay, and the maximum would be $200 per day, which is equivalent to about $52,000 annually. Our other choice is to actually pay the employee at their base rate of pay. So that doesn't take into consideration those extra types of pay. So our two choices are utilize the limits, or option two would be pay at the base rate. Now the limit is 2/3 pays, and I believe that was the one that gave payroll and Ms. Tidwell some heartburn about the calculation for that. And you can make a decision, even though both the options 4 through 6 on emergency paid sick leave and FML offer this pay option, you can vote on them separately or together as to the 2/3 pay or the full pay. The emergency paid sick leave is for 80 hours. The FML is up to 12 weeks, depending on eligibility and availability of FML for that individual.
I would move that we pay at the base pay rate for the 80 hours, but that we utilize the $200 maximum per day for FML after those 80 hours,
Expanded FML.
for expanded FML.
Second.
Second.
We have a motion and a second. Commissioner Brooks,
Yes.
Commissioner Allen,
Yes.
Commissioner Fickus,
Yes.
Commissioner Johnson,
Yes.
and Judge Whitley votes yes.
Okay.
C,
Yeah, I've got to read my note on that. Okay, we don't need to discuss that one because you all made the decision to pay the full amount. I'm making sure I'm right. The full amount on, no? Okay, so on, you do have to make a decision on 4 through 6 and FML. To make up the difference, do you want to, of that 2/3, do you want to allow the FML, I'm sorry, just the FML, do you want to allow the employee to supplement that with their own personal leave, which would take them possibly up to the 100%, or do you
I
want them
move that
to?
we let them supplement it with their own personal leave.
Second.
We have a motion and a second. Any discussion? Commissioner Brooks,
Yes.
Commissioner Allen,
Okay, yes.
Commissioner Fickus,
Yes.
Commissioner Johnson,
Yes.
Judge Whitley votes yes.
Okay, our fifth and final item.
I don't have a fifth item. Where's that at?
It's on the bottom of page 2, and it
Oh, I
is
guess
highlighted.
It is. All yellow.
It's all highlighted. So last week, there was discussion of granting those employees that worked during this time period of April the 8th to April the 14th, because remember, we couldn't go all the way back, retroactive back to March, that those individuals would receive 40 hours of leave time. So we need some details on that as to how y'all want us to implement that. And we know it, we understand it's the 40 hours. I'm going to make that assumption. We need guidance on what employees will be eligible for this. Will this be just full-time and project employees, which project employees work 40 hours a week? Would this be available to exempt and non-exempt people? So we, in addition to them getting hazard pay, we then give them another 40 hours. And would this be for folks that work on-site and or telecommuting, or just the on-site?
Who gets the PDD?
PDTO is available to both exempt and non-exempt employees. It's available to full-time, project temps, and part-time temps.
So that's, in my opinion, that's basically who we should give it to. Everybody else?
Is that a motion?
Yes.
Wait a minute. Okay, you go ahead.
It's a motion.
For the whole thing?
Basically, what I'm saying is everybody but elected officials, if they were working,
Okay. So
we can't give it to elected officials.
So
'Cause
can
we
I
don't get paid
ask,
for vacation.
What do we do?
so I just want to make sure I understand, because this came up. So the period of time that we're looking at was April 8th through the 14th. So the individual would have had to work and charged no PDTO during that time. They would either need to have been on-site or telecommuting, but basically charging active employment, active work. And if they were, then they get the 40 hours. Is that what you, I just want to make sure I understand your intent.
That is correct.
Thank you.
Okay, so I want to make sure, because there are several really decisions in here. So you want to give it to people that were on-site or telecommuting?
Correct.
Okay. They could not have been off any day during that period of time, either by PDTO or taking a vacation day or being out for any reason. They needed to have worked that full time. Okay. And this leave could be used for any purpose. So if I call, I could use it if I wanted to call in sick, or I could just use it for vacation. Always leave time is subject to the appointing authority.
Correct.
Okay. It has to be used before September 30th, 2021.
I can go along with that.
Okay? And there is no payout if the time is not used upon termination. It wouldn't be paid
That's
out
correct.
like any other kind of vacation.
That's correct.
Okay. All
I
right.
have a motion and I have a second.
I have a question.
I do too.
Commissioner Fickus, you have the second? It was Commissioner Brooks.
Yes.
Under those that qualify, it appears everybody qualifies, but full-time and project employees. Tell me again, are those Tom's part-time employees?
Well, he when I said that PDTO was available to part-timers, the judge added the part-timers to it. So full-time employees, project employees, which already work 40 hours a week, and then part-time employees that have a regular schedule. So part-time employees work every week about the same amount of hours. So those three classifications.
I know we had a discussion on, did we even include project employees a couple of weeks ago?
Yes.
And now we're
Yes,
talking
we did.
about giving them a week on top of what we've given them. Is that correct?
Well, these people are working. These are not off work. So these people have either been working on-site or telecommuting between the dates of April the
I understand,
8th.
but they're,
A number of
but some of them, have you been, all your part-time people working?
most of them.
They wouldn't qualify for this leave though unless they worked. That's
Correct.
what we've said.
Right.
So our part-time person has been on PDTO, so that individual would not qualify for this.
The project
But-
people are a number of them. maybe even the majority of them are paid out of dedicated funds, which I assume they just get paid out of those, right?
Okay.
Renee?
Well, they get paid out of those, but they would also then be eligible to not come to work in the future for the 40 hours, and they would be paid out of those same funds, yes. Now, they could qualify, if we chose to, for using one of our special funds, our CARES Act or our FEMA or some other, if they were during this time, but we'd have to decide that, whether they were to continue to be paid out of their existing pay, and then we seek reimbursement from some special pot, let's call it.
Okay.
Otherwise, you could wind up having to pay them out of your dedicated fund, because that's where they're assigned.
Sure.
Okay, Renee, let me move forward, Tom.
Yes.
Thank you, Tom. I know that when we started this conversation last week, we were specifically kind of talking about your employees, Judge, that all your people were here, and that a number of other areas had either people here or people actually working from home, had the equipment to work from home. I didn't realize that meaning that I was really thinking more in terms of exempt employees versus non-exempt employees. And now we've got non-exempt employees.
That's correct, but it's up to you all. I do need to make a point of clarifications. If we include part-time employees, they won't get a full 40 hours. They'll get whatever is their normal work week. If they work 28 hours every week, that would be what they'd be eligible for. But
Commissioner, what I was trying to do were for those employees who were working, they were getting paid the same thing as the ones who were not. And the ones that were not basically were off for a week.
But weren't
2 weeks.
Okay, but all the employees that were non-exempt who were working were drawing hazard pay.
yes, sir.
And you were, my understanding, we were doing this strictly for the exempt employees.
You know, I was doing it I meant to be doing it for everybody. Because the exempt, and that, it goes under the same scenario we just voted for a few minutes ago, and that was if they were still here, they were still subject to, face-to-face meetings with the general public, and therefore should be getting the hazard pay.
Okay?
So then non-exempt receive the hazard pay, and they'll also get it.
Non-exempt, yes, they would get the hazard pay, but they would also get time that they could take off, but they're not gonna get paid for it. It's just that from between now and September 30th of 2021, they can, take off a week versus the 3 weeks that whatever that word is, PDTO.
I just thought that we were equalizing those that were exempt and were working versus those that were non-exempt and drawing hazard pay of $6 an hour, and that was kind of the trade-off, that it never included every non-exempt employee.
I meant to include them.
Okay. Is that what?
I was under the impression that the vote last week was for exempt and non-exempt employees. My recollection was similar to the judges. So if you do limit it to non-exempt employees, it would be a change from what was voted on last week.
So this leave time is still subject to like our HR policy with the other leave times in terms of that the appointing authority would have to approve, right?
Absolutely.
However, right now, as I understand the motion that was made last week, that extra bucket time ends today. Unless we extend it through Friday as we did the PDTO time.
Are you talking about the dates we're looking at, if whether they worked or not? When you say that bucket?
Right now,
I'm not
we're
sure.
talking about, well, first off, I guess if we're just looking at these other things, we've approved the time through today.
Yes, sir.
And I think it's for all the people on this list that you have out here.
So last week you did take action to approve a creation of an additional leave category bucket for exempt and non-exempt employees up to the 40 hours if they worked during the period of time April 8th through the 14th.
Yeah, that's correct.
What I believe we're seeking today is clarification of these other items on here that we didn't go into, as far as that would not be eligible for payout, the ending date, etc. And so really that's all they need to take action on today, if they're still good with what they approved last week.
Correct. If they're not going to go back and change that, they could
Right.
do what's written here. Now, obviously, the part-time employees are included on this one.
I will move approval to clarify what I meant last week, if that's necessary.
Well, it just expands the clarification of when it expires and that they couldn't use any
Well-
PDTO and what else. Make sure I understand what you're
It
clarifying.
doesn't clarify when it expires. It expires today.
No, sir, I'm talking about the use of the leave bucket that we're creating. It expires September 30th,
Okay, yes.
2021. I'm
Okay.
asking for that. I'm asking for that it doesn't get paid upon termination. We've clarified how it can be used. It's the discretion of the appointing authority. And if we're clarifying who we're paying it to, which again is both exempt and non-exempt employees who worked telecommuting or on site, just that they could not have charged PDTO during the period of April 8th through 14th. That's
We
what
have
I've
a
heard.
motion that covers answers to all those questions.
Yes. I don't know if we have a second, though.
You
We
have a
second
motion
too.
and
We have a motion and a second. Any further discussion? Commissioner Brooks?
yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
No.
Commissioner Johnson?
Yes.
Judge Whitley votes yes.
Thank you very much.
Thank you, Robin.
I hope Robin went and sat down.
She's getting there.
Don't you even think about taking a
I'll
step
take-
in this direction.
I'll second that motion, Roy.
Go ahead, Mr. Manius. Sure has taken us a long time to get out of your area. And we're still not.
We're going to rearrange the agenda next week. Okay, so, where are we at? So, members of the court, if we could go to item 5 under the administrator's office. This should be short and this should be really good news. We're requesting that the Commissioners Court accept a prepaid capital refund check in the amount of $1,006,898.58 from the Texas Conference of Urban Counties for the Texshare Jail Development Project.
Move approval.
Second.
We got a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes. Ms. Tidwell?
I move that we receive and file the Tarrant County financial statements for December 2019.
Second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes. Moving.
Move to receive and file the personnel agenda.
Second.
We have a motion and a second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge votes yes.
Thank you. We have two additional items. The second item, we're asking the court to approve a waiver of terminal benefits for the 67th District Court. Judge Cosby is requesting a waiver of 392 hours effective May 2nd, the details of which are outlined in your communique. We're estimating the net cost of this request to be approximately $15,000, including fringe benefits to the general fund.
Move for
approval.
Second.
We have a motion and a second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes.
Our last item, item 3, we're asking the court to approve an extension of project employment. This is in the district clerk's office. Mr. Wilder's requesting the extension of a project employee through April of next year. There is no impact to the general fund. These would be district court record fund.
Move for approval.
Clerk's records fund.
Sorry. Thank you.
As long as we got all these things we've given those people.
We got a motion.
Second.
We have a motion and a second. Commissioner Brooks?
Yes, with my standard caveat that if we're going to keep people this long, they ought to be permanent employees.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes.
Member of the court, under public health item number 1, we're requesting that the court waive late fees for food service establishments permitted by the health department while the COVID-19 shelter-in-place order is in effect. The fiscal impact is a loss of revenue of approximately $808 per month.
Move approval.
Second.
We got a motion and a second. Question?
So this is just, so if I were an establishment that needed a permit, but I was late in acquiring it, then we're just waiving the fee for that, right? So I still am permitted, but.
You're permitted, you just don't pay the late fees.
Okay, very good.
Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes.
So on item number 2, we're requesting that the court approve amendment number 1 to an ILA between the Health Department and the county and the Department of State Health Services for the North Texas Syndromic Surveillance Program.
Move for approval.
That needs to be empty.
Second. We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes. Mr. Beecham? Boy, we're moving now.
I wish we had 21 items for consideration this morning. Of the
If
two
you
items,
would, we wouldn't be considering it.
2 items we have, we go out to our item number 2, which is a bid award recommendation for RFP 2020-074. This is an identification verification service for ordering and processing certified copy for the county clerk's office. Recommendation be to award for the terms of the contract according to LexisNexis Vital Check Network.
Move for approval.
Second.
We have a motion and a second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge votes yes.
Number 3, also bid award recommendation, bid 2020-083, annual contract for electronic fire alarm inspections, maintenance, repairs. Recommendation to be awarded per enterprise basis and percentage markup for parts awarding to the primary, secondary, and alternate vendors as shown in the court communique.
Move for approval.
Second.
We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge votes yes. Are there any appointments today? There being none, then you have before you the claims including the addendum.
Move approval of the claims including the addendum.
Second.
We have a motion to second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge votes yes.
Your Honor, we do not have any closed session items today.
There being no further business, we're adjourned.
Yeah.